Good afternoon. I am honored to be joined today, as I am, I believe, every single day, by the woman who needs no introduction to my right, Commissioner, Department of Health, Judy Persicelli. To her right, Department of Health Communicable Disease Service Medical Director, Dr. Ed Lifshitz, another guy you've seen a lot of lately. Nice to have you with us, Ed. Far left, State Police Superintendent Colonel Pat Callahan. Pat, as always. Director of the Department of Homeland Security and Preparedness, Jared Maples, is with us. Jared, nice to see you. And the man to my immediate left, the Department of Education Commissioner, Dr. Lamont Repillette. Nice to have you with us, Lamont. I've asked Commissioner Repillette to join us to provide an update on the situation with regard to our schools, which I have previewed over the past number of days. As has been our practice of late, we will open with the reports we have received over the past 24 hours. First, we are announcing another 3,361 positive test results, 3,361, which moves our statewide total to 44,416. 44,416. And sadly, and this is with the heaviest of hearts, we have also lost, and this is sadly our highest toll to date, we have lost another 232 of our precious fellow New Jerseyans to COVID-19 related complications. Our state has now lost 1,232 precious lives. At this time, Judy, if I'm wrong about this, you'll correct me, 3 previously reported deaths have been removed from our count, and Judy will be able to speak not only to that, but to give you some color on the positive tests as well as the blessed souls we have lost. It's almost unfathomable, folks, when you think about that, 1,232 lost lives. I would like to mention 2 of the tremendous individuals in particular who we have lost. First is Dr. James Wilson, who passed away on Monday night at the age of 93. There he is with his son, Sid, and I'll come back to Sid in a moment. He had lived in Bergen County for the past 50 years. Born in the Dominican Republic, he was a pioneering physician. In the 1960s, he became one of the very first Dominican physicians to open a clinic in the United States in New York City's Washington Heights, where he tended to patients for more than 40 years. He and his wife Nilda recently celebrated their 54th wedding anniversary, along with their 6 children and extended family and friends. And as I say in this photo, he's with his son Sid, who is a dear friend. We send our condolences to everybody who knew him, obviously, and most importantly, his family, to Sid and his fellow family members. What a life. We also lost Diana Tennant of my county, Monmouth County, and there is Diana. She worked for many years at the Fulfill Food Bank of Monmouth and Ocean counties, helping to feed countless families. She was a leader within the Latino Coalition of New Jersey and was a past chair of the Latino Festival, a festival that I've been to several times of Monmouth County. She is remembered by her friends as someone who always had time to lend a hand. Diana was only 51 years old and had so much more to give. We also send our condolences, prayers to her family and friends at this time. These are just 2 stories of the many, many more we could tell of those who we have lost. Every single one of them has made our New Jersey family what it is, and we honor their legacies as we grieve with their families. None of them, you have my word, none of them will be forgotten. And for them and for their families, we need to continue doing all we can to keep slowing the spread of coronavirus. We don't need to, nor do we want to, in any way, lose any more members of our family. The best way we can protect this New Jersey family is by social distancing. Yesterday, we noted that we're beginning to see, and I don't want to overstate this in any way, the very first potential signs that the curve may be finally flattening. And if you look at the positives today and you put the denominator of the positives that we've already had, you'll see a little bit more of that evidence. But we cannot be happy with only reaching a plateau. We need to keep strong and keep determined to see that curve begin to fall and ultimately get to zero. That's going to require many more weeks at the least of our being smart and staying at least at all times 6 feet apart. This morning I spoke with Governor Cuomo and exchanged notes with Governor Lamont. I reached out to Governor Wolf. Well, we are not there yet. I repeat, we are not there yet. We all agree that just as we had a regional approach to dealing with the upside of the curve, and still do, we discussed in a general sense, a regional approach to the things like testing, tracking, and the reopening slowly and responsibly whenever that moment comes of businesses and schools, and potentially a regional approach for mobilizing resources when coronavirus comes back, as many predict it will, or for the next pandemic to come. No one wants to see our state get back up and running as much as I do, or anyone up here wants to. It's the singular goal that we are all working toward. But we need everyone in this with us. We can't do it alone, and it's not just for the 5 of us to do, or our other colleagues are here. Parimal Garg, by the way, from Council's office is with us. Parimal, thanks for being here. It's not just for us to do, it's for all 9 million of us to do. So keep practicing your social distancing, even when outside, and even when wearing a face covering. Remember, a face covering, and we've all worn them coming in this morning, and we're wearing them now regularly, if not constantly. A face covering, Judy, am I right, does not trump social distancing. Social distancing is the king. The face covering is important, but it is not more important than social distancing. Stay indoors, stay at your home unless you absolutely need to go out, or unless you're one of the essential workers we need out there to help us get through this. Keep washing your hands regularly with soap and water for at least 20 seconds. And if you feel like you're under the weather, that's okay, but don't even think of going out or getting near anybody. There's going to be plenty of sunshine and summer to come, and the sooner we can flatten that curve and come down the other side of that curve, the faster we can all enjoy it. Switching gears for a couple of announcements, if I may. Tomorrow morning, I will be touring, Pat, I believe with you, with Colonel Callahan, I believe Senator Cory Booker, the field medical station being set up right now at the New Jersey Convention and Exposition Center in Edison. We will be joined, I believe, by both Major General Jeffrey Milhorn and Lieutenant Colonel David Park of the U.S. Army Corps of Engineers, and we'll also be joined by Major General John King from the Department of Defense, and just up from the great state of Georgia, and in our rock as we speak. As you know, folks, this is our second field medical station. It will also be our largest, Judy, at 500 beds, right? We remain immensely appreciative of the partnership from the Army Corps and of the federal administration in helping us bring these much-needed beds online. Next, today, I am signing not 1, not 2, not 3, but 4 executive orders. That is not a typical day by any stretch. Number 1, I am extending by 30 days the public health emergency I initially declared on March 9th. These declarations, unless extended, actually expire after 30 days. So this ensures we'll continue on our current war footing for at least another 30 days. Second, I am signing an order, and I don't do this lightly, and I don't do it with any joy, to close all state and county parks in the state of New Jersey. We have seen far too many instances where people are gathering in groups in our parks, erroneously thinking since they're outside, social distancing doesn't matter. Nothing could be further from the truth. We understand that staying at home is hard. We get that. And then you need to get some fresh air. but you must do this close to home. Take a walk or bike ride in your neighborhood or at a park in your town that is open. And by the way, the decision, unless Paramount corrects me, of municipal parks to be open or closed is up to the municipality. That is a decision that is made locally by the municipality. And by the way, don't travel to somebody, if you hear your town's parks are closed and the next towns are open, please don't travel to someone else's parks. We need 100% compliance to flatten the curve, and unfortunately, that now requires us to take this step. And again, don't think that I take this action lightly. Some of my fondest memories with my own children and Tammy are beautiful spring days in parks playing soccer, going for a run, enjoying our family. But my focus and our focus, our sole mission right now, is the health of every New Jersey family. And we must not just flatten this curve, we must crush this curve. My final two orders pertain to our public schools. Charlie, I hope you're listening wherever you are. I am signing an order to extend certain deadlines for boards of education that still operate on an April election time frame, because their elections, as you heard a couple of weeks ago, have now been postponed until May 12th. There are only a few more than a dozen districts statewide which still hold to the April time frame, and my order will ensure that they have enough time to certify their budgets and make staffing decisions for the following year. My final order follows my directives last month, indefinitely closing our public schools and canceling our statewide assessments. First, I am waiving the student assessment requirement for graduation this year, including the portfolio appeal process. This means that the 13,000 current high school seniors who have not yet satisfied the student assessment requirement will no longer have to submit a portfolio appeal in order to graduate. This order also waives the use of student testing data for educator evaluations, which was not feasible anyway, given that we have canceled this year's standardized tests. I thank the man to my left, Dr. Repillette, and his team for his work with, among others, the NJEA, lawmakers, and stakeholders on this, and for the work to come on a process for properly evaluating our educators without this data. A couple of announcements on testing. First, tomorrow, April 8th, the PNC Bank Arts Center drive-through site will be open at 8 a.m. and remain open until either 4 p.m. or when it hits its capacity of 500 tests. The Bergen Community College site will be closed tomorrow, but it will reopen on Thursday, April 9th. Additionally, and this is a little bit of a switch, both of these sites will be open Saturday, April 11th, for 500 tests apiece, and they will both be closed for Easter Sunday. Separately, Gloucester County will open a testing site tomorrow at Rowan College of South Jersey. This site will operate for Gloucester County residents only and is by appointment only. To receive a test, you must be pre-screened for symptoms. Again, in a world of scarce resources, we must focus and continue to focus on symptomatic folks. You can be pre-screened for the Gloucester County site by calling 856-218-4142, 856-218-4142. As I mentioned yesterday, there are now more than a dozen publicly accessible testing sites whose information can be found by visiting our online portal at covid19.nj.gov/testing. Again, covid19.nj.gov/testing. However, there are many more sites being run by hospitals or other private sector partners that are not listed. If you believe you are showing coronavirus symptoms, please call your primary care practitioner right away, and they can assess you. And if you meet the standard for testing, they can direct you where to go to get a test. And Brady, I believe at our last count, we had at least 50 sites around the state. On to donations and PPE. I want to start by giving a huge thank you to Hilton and American Express which in partnership with Hilton's ownership community are donating up to 1 million hotel room nights across the nation and through the end of May to doctors, nurses, EMTs, paramedics, and other frontline medical workers who need a place to sleep or recharge or to isolate from their families. We know that there will be frontline responders in our state, including many of the volunteer medical responders we are bringing in who will need a place to stay throughout this emergency, and we cannot thank Hilton and American Express enough. Next, on PPE, we continue to pursue every possible avenue for PPE on our own, and I know, in addition, Pat, to your compliance report, you'll want to comment on any developments there, whether that's on the open market or via the strategic national stockpile. And from the stockpile, our latest accounting shows that we have brought in and distributed more than 1.1 million pieces of PPE, but goodness knows we still need more. I want to give a big shout out to BASF, which is donating 1,000 gallons of hand sanitizer that it is producing right here in state at their facility in Washington Borough and Warren County. We are greatly appreciative of their efforts. From Monmouth County, we learned that Hatteras Press in Tinton Falls created 7,000 protective face shields for healthcare providers and first responders that have been distributed across the state. Owner Bill Durer reported that he is planning to create another 10,000 a day over the next 2 weeks. We cannot thank Bill and Hatteras Press enough. And notably, Bristol Myers Squibb is donating $345,000 worth of PPE to New Jersey. Some of these supplies are already at their facility in Princeton and will be delivered immediately to medical facilities in need, and an additional shipment is expected to arrive in the coming weeks. BMS, you may have seen this also announced this morning, I believe, that it is expanding its patient support program to provide free medicines to those who have lost their health insurance due to this emergency and its impact. I spoke this morning, and I want to thank him publicly, to CEO of Bristol Myers Squibb, Giovanni Caforio, who's a good friend, for all that BMS is doing. And I might also add, in addition to Giovanni and the BMS team, his wife is running a food bank in Princeton that is feeding upwards of 400 families a day, and we thank her and the entire BMS family. If you have PPE to donate or the means to produce it, we are still, believe me, and will be for a long time, accepting your donations. Please reach out to us at covid19.nj.gov/PPE donations. And Colonel Callahan's team will be in touch with you to accept your donation. And in advance, we thank each and every one of you for both the small slugs and the big ones and everyone in between. And so we'll keep doing what we're doing, and you keep donating. And together we can get what our public health and safety responders need, and they are our heroes today and every day. First, before I close, I want to give a huge collective thanks to the communities across the state who are getting creative in celebrating their friends and neighbors' major milestones while practicing social distancing. Tammy and I had a call with members of our team this morning with faith leaders and thanked them particularly in this, with Passover beginning tomorrow. We're in the midst of Holy Week, Easter on Sunday, Ramadan not too far down the road. All of us have the inclination to want to come together, and we can't. We must resist that at all costs. And there's been enormous cooperation around the state, both by community leaders and faith leaders, and the creativity is extraordinary. So folks are getting creative, in particular, as I say, as they celebrate their friends and neighbors' major milestones, sadly, including funerals and memorials, while at the same time practicing social distancing. Thanks to the news reports and to all of you tweeting us at #NJThanksYou, we've learned of countless stories of friends standing across a street with happy birthday or just married signs, posting signs of support for our heroic essential workers on their front doors, or residents organizing online fundraisers to support our public health and safety responders. This is precisely the community spirit we need right now to get us through this time. We can't be physically together, but what you are doing to ensure that your community knows that everyone is being thought of and everyone is being celebrated. That's how we do it. I want to share another idea before I turn things over to Judy that was sent to my way by my dear friend Bill Lavin. Bill is the former president of the State Firemen's Mutual Benevolent Association, or FMBA, and he's a retired Elizabeth firefighter. Today he founded and he runs Where Angels Play Foundation, which builds playgrounds for kids who need a safe place to be kids, in memory, by the way, of fallen kids, and it has a global reach. Recently, Bill's team lost a longtime volunteer to COVID-19. They couldn't gather with her family to mourn her passing, but they wanted to do something to let them show how much she meant. So they took up a collection and they purchased gift certificates to that volunteer's favorite restaurants, which they then gave to her family. In doing so, they are supporting a small business that really needs a helping hand right now. And once this emergency ends, the family will be able to gather and eat at a place that was so special to the loved one that they lost. I think that's a good place to end my formal remarks today. We will get through this unequivocally. We will be able to be together as a family, as one family again. But to do so, we must continue to keep what we're doing right now and have been for the past many weeks, to flatten the curve, break the back of that curve, and then get to that better place where we can all be better, where we all can be close and be together again. We can do this. It will not be easy, and I know it isn't easy right now. And you have our enormous thanks and respect. It won't be fun. We know that we are not out of the woods yet. We're not close to that. And that more residents, sadly, will fall in, and some will not be with us when we get to the other side. But we have to do this to make sure that those numbers are as low as we can make them, and certainly as low as they otherwise would be. We get there together, folks, as one extraordinary New Jersey family. Keep doing what you're doing. Keep staying home. Keep staying a distance from each other. And if you do that, we will get there. We are all in this together. We'll only come out of this if we stay together by, ironically, right now, staying apart. With that, please allow me to turn things over to the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. As I've mentioned before, we are being vigilant about all of the residents in New Jersey, especially the most vulnerable, those in mental health facilities, long-term care facilities, pediatric long-term care, and state and county jails. We know these individuals are at risk because of the congregate settings within which they reside. As I've shared with you, our long-term care facilities continue to be severely impacted. Right now, 188 of our long-term care facilities in the state have at least one COVID-19 case. On Saturday, I spoke with the head of the Long-Term Care Association, and I advised him that if the facilities weren't complying with state law to notify staff, residents, and families about their outbreaks, that we will release their names of those who are not in compliance. We are still contacting each and every facility to make sure that they are releasing the information and to receive documentation of that. A majority of them are telling us that they're complying. But what we are learning is somewhat more disturbing. They have also shared with us that they feel they don't have sufficient resources or sufficient staff to take care of their patients. So we decided this morning, the team at Department of Health, that we have to develop a statewide plan to assist the nursing homes that are experiencing outbreaks and also shortage of staff and equipment. This will be a whole-of-government approach. It will cover from North Jersey to South Jersey. It will require, in some cases, for patients to be moved around, and that's extremely disturbing to elderly individuals. But for those that have not been exposed, we want to keep them safe, and for those that have been exposed, or perhaps diagnosed positively, we want to make sure that they get cared for. The department has also been closely monitoring our 4 state psychiatric hospitals. Currently, there are 46 staff members and 34 patients who have tested positive for COVID-19. So we're working with the hospitals to conduct surveillance and implement the infection control protocols to reduce exposure. The Department of Human Services, has reported 24 positive cases, including 1 death among the 1,200 individuals that they serve at our developmental centers in the state. The Department of Corrections has reported a total of 67 employees, 5 inmates, and 3 individuals in their residential communities that have tested positive for COVID-19. The Department of Corrections website identifies those numbers and are broken down by facility. The department is in close communication. The Department of Health is in close communication with all of our sister agencies on these impacted populations. Currently, as of this morning, there are 7,017 hospitalizations, which include COVID-19 positive patients and persons under investigation. 1,651 individuals are in critical care, and 94% of those individuals, 1,540, are on ventilators. You may recall that in our worst case predictive modeling, we shared that we may have 8,000 critical care cases with 7,000 on ventilators. I want to assure you that our plans are moving in the direction to be able to accommodate these patients, but we still need ventilators. I want to take a moment to go over some of the department's COVID-19 guidance for healthcare providers. Current department guidance does not allow for healthcare providers to return to work while they are still symptomatic. With the understanding that some have mild symptoms, such as a slight cough that may persist for long periods of time, that is not considered to be exclusionary. Our guidance, which follows the general CDC guidance, recommends that symptomatic healthcare workers who have tested positive for COVID-19 may return to work 7 days after the symptoms first developed and 72 hours or 3 days after fever has resolved without the use of fever-reducing medications with a significant improvement in symptoms, whichever period is longer. Although it's not recommended that those without symptoms get tested, should an asymptomatic healthcare professional test positive, they should continue home isolation for 7 days after their first positive COVID-19 test, provided that they remain asymptomatic. And out of an abundance of caution, they should also be masked while at work. If an individual has no symptoms, tests positive, they can discontinue isolation when at least 7 days have passed since the date of their first positive COVID-19 test. Please go to the Department of Health website or the CDC website for more information on this guidance. It is important to follow these recommendations to limit the spread of COVID-19 in our state. As the governor mentioned, we are reporting 3,361 new cases for a total of 44,416 cases in the state. And yes, sadly, 232 new deaths have been reported to the department, of which 33 were residents of long-term care facilities. So there are now 1,232 fatalities in our state. As the governor mentioned, 3 of the deaths reported yesterday were removed from our count. These numbers change occasionally because after further investigation, we find more details that could lead to the individual being removed from our count, such as a death being reported in New Jersey, but turns out the individual may not be a New Jersey resident or not meeting the criteria to be classified as a death due to COVID-19. Of the deaths totally, the trend continues. 60% male, 40% female, 1% under the age of 30 or 11 cases, 5% 30 to 49 years of age, 17% 50 to 64, 32% 65 to 79, and 45% over 80 years. 60% or 435 of our cases are reported as individuals who report as white, 24% or 175 as black or African American, 5% reported as Asian, and 11% as other. And at this point, 44% have documented underlying conditions. However, there are 670 cases that are still under investigation for underlying conditions. And as reported, 10% from long-term care facilities. So, of course, we offer our sympathies to the families who have lost loved ones, and as in the past, and now in this most spiritual of times in our calendar, I remind you to stay connected, support one another, reach out to those, your relatives and friends who are alone or with you, may be fearful. And remember, be careful, be safe, be healthy, and stay home. Thank you.
Judy, thank you. You may have said a positivity rate on the testing. Did you say that?
I did not. Let me just find that. The positivity rate is tracking the same, over 40%.
Mid-40s?
Yeah. Mid-40s.
Also, top 5 counties in total cases. This has stayed about the same, although Hudson has really shown over the past several days. Unfortunately, it's closed in closer to Essex. So you got Bergen number 1, Essex number 2, Hudson 3, Union 4, and Passaic 5. So those have continued to be the 5 counties with the most cases now for 7 or 10 days.
On the positivity rate, we have tested 89,911. The positivity rate is 43.77%. That's 39,353 testing positive.
And again, we'll remind everybody a couple of things. Number one, these are overwhelmingly symptomatic people. So they're going to be, Ed, unless you disagree, they're going to be on average less healthy than the average New Jersey resident. And secondly, we're getting these, I'm not sure what we think our current delay is, but these are specimens that we're announcing today that were collected 12, maybe as 10 to 14 days ago, right?
Yeah, the commercial labs are all overloaded as well.
And then we continue, and it's early, and I'm proud of the fact that we've added it. But again, I think Judy and I both agree it's imperfect, but you're beginning to get some sense of race of the fatalities. Bless their souls. And one of the things that we're focused on, and many are focused on, is that not that that's the only metric by which one can draw conclusions, but it is overwhelmingly the case that even in peace times, never mind in times of war, such as the one we're in now, that communities that are usually left behind are further left behind. And it doesn't correlate entirely to communities of color, but invariably that's the reality that we're dealing with. And so the more we, as Judy and team go through this, and with each passing day, the better a handle we have on the profile of these blessed fatalities, the better we'll be able to react and respond to the community work that's going to need to be done to pick up the pieces going forward. Long-term care facilities, again, Judy, you mentioned
188.
188, that's almost exactly half of the long-term care facilities in the state.
There's 375 long-term care facilities, and another probably 200 assisted living types, dementia homes.
Yep.
So put it all together, it's still a number that we're so concerned about.
And so this is going to be an area that you mentioned with the state plan. That's something we're going to be coming back to folks just to give them more color on what that looks like over the days ahead. Pat, with your blessing, I'm going to turn to Lamont next, and then we'll have you back clean up. Is that okay with you? Again, great to have the Commissioner of the Department of Education with us. One of the most dramatic steps we've taken is to shut schools in this state, period, public, private, religious, all. And it's something that we've never done before. And as we said at the time, we wanted to do as good a job as we could to get out ahead of what we thought some of the challenges would be. The ability to learn remote, period, but also for the big chunks of our state which don't have ready access to devices, to be able to feed kids when their most reliable meal every day is from the school. The general challenge of remote learning and all of the extraordinary work that our educators and moms and dads are doing. And so we thought it made sense to give folks a quick sense of where we think things are, maybe a little bit on where they're headed. And I'm honored that the boss is with us. Please help me welcome the Commissioner of the Department of Education, Dr. Lamont Repellent.
Thank you, Commissioner and Colonel, for your leadership. These extraordinary circumstances call on all of us, me and my colleagues at the Department of Education, superintendents, principals, teachers, paraprofessionals, and support staff, food service directors and workers, child study team members, parents, to reach for new heights of innovation, collaboration, and mutual support. We have been in this now for 20 days. 20 days ago, all New Jersey schools were ordered to close, and I ask that the education community give itself some grace. Adjusting to these unprecedented times requires unprecedented acts of leadership and humanity. I am extremely proud of and impressed by the education community and parents for meeting these complex challenges. Today's executive orders are designed to allow to keep uninterrupted focus on what matters most, our community's basic educational needs. We recognize at this time completing the portfolio appeals process will be an unwelcome and counterproductive burden for our students and our districts. We recognize that we must provide some flexibility from typical educative evaluation procedures to allow districts to engage meaningfully with their teachers, students, and leaders. These adjustments are necessary to allow districts to continue the important work of providing critical educational services to all of our students in light of the complex challenges we face. I'd like to highlight some of that work, Governor. Instruction and technology. As schools and districts began preparing to carry out closures, the department strove to provide every flexible available to empower school leaders to continue providing instruction to students. That was phase one of the department's COVID preparedness work, meeting the needs of students and meeting the 180-day requirement. In phase two, we have been gathering feedback and data from districts on their successes and challenges in implementing their instruction. To make good on our commitment to equity of access to instruction, the department had to better understand the digital divide and how the state can go about bridging that divide. A survey distributed to every district helps us better understand this landscape and our ongoing challenges. 70% of districts have reported that at least 90% of their students have access to the internet at home. But to help fill gaps, districts across the state are actively helping families connect to the internet at home through activities such as connecting eligible families with free internet services, providing donated or purchased hotspots, launching public-private partnerships to boost internet access, and working with local public libraries to lend hotspots to families. Our last report indicated that even with the help of innovative measures like these, of the New Jersey's 1.4 million public students, about 110,000 cannot access the internet at home, and nearly 155,000 students need one-to-one devices. We continue to work with districts and provide any resources and flexibility we can to help drive those numbers as low as we can. For our students with special needs, we were proud last week when the State Board adopted temporary regulations that allow school districts and educational agencies to deliver special education and related services to students with disabilities through the use of telepractice. We are hopeful that this flexibility will help school districts and educational agencies ensure that students with disabilities receive the services that are entitled to them. And for our students, school districts around the state are using the nurses, counselors, and other health professionals to increase mental health service and emotional supports, assist with wellness checks, and provide targeted assistance for students identified as most at risk. My staff has been working with social and emotional learning associations to collect research and resources on how schools can manage the emotional impact of this pandemic on their students. Food. It is impossible to address the health of our students, however, without addressing food security. The New Jersey Department of Agriculture has been doing the critical work of ensuring that school districts have the tools to continue providing school meals. I would like to thank Secretary Fisher and his team for their collaboration. The DOE is partnering with local Office of Emergency Management to help ensure food is safely distributed. We have visited over 100 food distribution sites and continue to provide assistance on safety protocols such as establishing grab-and-go distribution models and using social distancing best practices. We know that more work remains to be done. We know that districts face particular difficulties with their youngest learners and with the readiness of their workforce to shift to a remote instructional environment. With this data in hand, Phase 3 of our plan will be to bolster targeted, individualized supports through our boots-to-the-ground field service efforts. We also hope to synthesize the many lessons we learned in an after-action report on school closure to ensure our state is prepared should, God forbid, Governor, we ever confront a challenge like this again. Thank you again to the entire educational community for rising to these complex challenges and continuously centering the needs of all of our students and educators. It is an honor to partner with you in this critical work. Thank you.
Lamont, thank you. A couple of things before we turn to Pat to bat cleanup here. I want to give a big shout out. Someone I was on a lot with today. I just want to reiterate, Andy Slavitt has been a huge resource for our state and for our team. And I can't overstate that enough. And part of the reason I raise that is he and I were in a conversation this morning, and we're going to have a massive post-mortem whenever it is the dust settles as a nation, for sure. And I hope that it emulates at the national level as well as at the state level. We in New Jersey will need to do a big post-mortem. I hope it emulates the leadership that Governor Kane showed along with Congressman Lee Hamilton for the 9/11 Commission. We need to do that as a nation, and we certainly need to do that as a state, whether it's healthcare matters and certainly educational matters. When you do something you've never done before, and as you said, Lamont, God forbid we never have to do it again, but in the off chance we do, we better darn learn those lessons. As they say, if you don't learn the lessons of history, you are destined to repeat it. So thank you for that. One other comment before Pat jumps in. I think Judy and I would both want to say this. A life lost is a life lost. So sadly, the numbers are what they are. And by the way, of the total fatalities in our state, almost 1,000 of them have been in the past week. So of the 1,232 lives, precious lives lost, just under 1,000 have been in the past week. Think about that for a second. But it's also fair to say, Judy, I think this is a national phenomenon, not just a New Jersey phenomenon. The weekend skews when the data comes in. A fatality is a fatality. Sadly, we can't bring these people back. But the up and down on the numbers, just we wanted to mention again, we've said this before, these don't all they didn't all happen since 2 o'clock yesterday afternoon. Is that fair to say? It's a multiple day reality that comes to it.
And reporting during the weekends. That has been noted nationally that it's not as accurate. So if you average it, if you smooth this out, you average it out, it's still, we don't like the numbers, but it's about 130 a day, Saturday, Sunday, Monday.
And a life lost is a life lost. Nothing we could do to bring them back. Our job collectively, all 9 million of us, by the way, is to lose as few lives and have as few people sick as possible. So thank you for that. Dr. Lamont Repillette, thank you for your leadership and for your remarks. I'm sure folks will have questions. Colonel Callahan, as usual, the bat cleanup on compliance, on PPE, Any other matters? Department of Defense update. Great to have you, and thank you for your leadership.
Thanks, Governor. Very quickly on PPE, in addition to the tens of millions of orders we have from the state for PPE, we do have a request into FEMA for 4.5 million N95 masks, for 5.7 million surgical masks, for 6.8 million gloves, for 3.9 million gowns, as well as 3.8 million face shields. We have more than 1,000 medical beds on order for the upfitting of that hospital capacity relief team that's out there trying to upfit wings and mothballed hospitals. And I think one of the greater stories, which I don't even know if it's been reported yet, was last night we received word from the state of California on the Emergency Management Assistance Compact, EMAC mission. California, knowing what New Jersey and New York are going through, the Department of Defense is flying 100 ventilators out to us today, and they will land today with the understanding that in 3 weeks or so, they're probably going to be needing them and hitting their surge and peak. So that's the type of I think that collective effort, understanding we're being hit now, but as this thing moves its way across, that return of the favor, I think, is what we'll be in the position, hopefully, to do that when we get to the other side of the curve. So just a good story and an indication of the team effort that's happening across state boundaries. With regards to compliance, I just want to lead with a story from the Attorney General's office in conjunction with the Division of Alcoholic Beverage Control. If you recall, last week I had reported a pub up in Blairstown was cited twice. Well, the Attorney General Graywall, and Director Graziano from the Division of Alcoholic Beverage Control are seeking to revoke the liquor license of that establishment in an indication that not only will the violation of the executive orders not be tolerated and zero compliance, but that the Attorney General, as well as the Division of Consumer Affairs and all the licensees and the regulatory functions they oversee, including Division of Alcohol Beverage Control, that they have that authority too to go after those licensees and revoke them. So I think I thank the Attorney General for his action and leadership in that regard. Just a few on the overnight. Elizabeth, there was a domestic violence stabbing incident on that subject while being taken into custody, coughed and spit on the officers, indicating, screaming that he had COVID. Newark issued 38 executive order violation summonses and didn't have to close any businesses last night, Governor, so that was good. Trenton Police Department reported enforcing 2 executive order violations and closed 1 business. In Rumson, if you can recall the party that the governor spoke to, after further investigation, an additional subject, a 46-year-old male, was charged with disorderly conduct and disturbing the peace. Another subject in Monmouth Beach was arrested for being at a closed pavilion in violation of the executive order in order to smoke a controlled dangerous substance. And in Camden, a large gathering of 20 or more people who were arguing was broken up, and a woman who refused to comply with the officers' orders to disperse was also charged. That's all I have, Governor.
Colonel, thank you. And again, I meant to give this shout out earlier to Governor Newsom. All I could say is I hope that we have a Lafayette, we are here moment, and we can say that it may take some time, but we will return the favor as soon as we can responsibly do so. So thank you for all that. And again, we're going to enforce. We reserve the right, as we've said today. Again, with mixed emotions, but there's no question we have to do it. Closing state and county parks, so we reserve the right to take further action. But in most respects, it's going to be whether or not all 9 million of us are adhering to the actions that we've already taken. And thanks to Colonel Callahan, the Attorney General, and to law enforcement up and down the ladder and up and down the state, enforcement is going to be the name of the game. So thank you for that and for every day. I think with that, Matt, I don't want you to pull a hamstring, so I'm going to give you a second to get over there. We'll start with Brent, and we'll sweep from my left to right. Just while you're doing that, tomorrow, I think at 10:15, we're touring the field medical station in Edison. and I'll be there for a brief with the Colonel, and as we mentioned, I hope Senator Booker and some representatives from our military and Army Corps, and then we'll be here tomorrow, unless you hear otherwise, at 1 p.m. Thursday is always subject to whether or not there's a White House VTC, and assuming we can get the data, and so bear with us on this, in respect of folks who observe Good Friday, and I would be on that list, we are likely going to be here, but earlier than normal on Friday, try to finish before noon if we can. So we'll give you more details. Mahan will let you know. Brent, we'll start with you.
All right, so I have a few because I'm reporting for other people. One, the public health emergency, that's the state of emergency you ordered on March 9th that's been extended. Two, I missed the racial breakdowns, and was that for total cases or just the new ones?
Keep going.
Three, how many total cases, active and inactive, would we be expecting at the peak, whenever we're expecting the peak? Are you aware of a standard policy of issuing one surgical mask and face shield per employee per week? Is this acceptable? Are we really that bad off? How does this policy not spread infection? Should candidates not be campaigning in person or door to door? How many police officers have tested positive and how many are quarantined? New Jersey has the 5th highest number of legal immigrants with healthcare backgrounds who are not working in the healthcare industry because they hold degrees from foreign universities. Are these among people you're asking to volunteer to help cope with the virus? You mentioned coordinating to restart the economy. This is from Politico. You mentioned how you're coordinating a regional approach to restarting the economy. Do you anticipate this will rely on widespread testing in each state? And how long do you
I just want to ask, do you think we should, maybe we'll just roll into tomorrow's briefing? What do you have, man? Come on.
How long do you think it will take to scale up testing to that level? I could go all day. So.
Yeah, we love you, but we can't let you go all day.
Right, go ahead.
Do you have a microphone, Paramount? The public health emergency from a month ago, just if you real quick answer Brett's first question.
Sure. So
Brett's question started yesterday, so I think that was his first question.
Today's order is just extending the public health emergency. The state of emergency that we declared on March 9th is indefinite, so that didn't need to be extended. But the public health emergency pursuant to the law the legislature passed has to be renewed every 30 days.
You know what order number that was?
It was Executive Order number 103.
103. Thank you for that. Judy, one more time on racial breakdown. Do you have that handy? Do you have your mic there?
This is these are obviously, excuse me, not all of the cases. Of the 729, known cases.
Again, this is 729 cumulative. You'll note that there's another almost 500, or perhaps more than 500 that we still don't know yet, right?
60% or 435 are white, 24% or 175 black or African American, 5% or 36 Asian, and 11% or 83 listed as other.
I would just say this, that is I meant to say this earlier when I made the comments about, as imperfect as it is, getting the racial breakdown is something that we all feel is important. Just without knowing what's in the other category, the number that jumps out is the African American number as it relates to the overall population. That is a meaningfully higher percentage, at least of that cohort, than it is in the state of New Jersey. Judy, total cases, as I remember these, total cases at peak?
According to the Lashmi model, I believe it was 37,000.
I thought 36. I'm in the same neighborhood.
Yeah.
Again, this is, remember, the Lakshmi model we showed you yesterday had as the runaway freight train number of folks who are infected as just about 3 million. Good news and bad news. Good news is, based on the evidence that we have, and this is a, we're in the second or third inning maybe at most, but based on what we now know, we've brought that number down, the range for that number down meaningfully in terms of total persons infected. The Lakshmi model, and again, I'm not referring to Chime, but the Lakshmi model's worst case is 509,000, as I recall.
It's over 500.
Over 500,000 infected, and from that, 35,000 folks would require, 35 or 6,000 require hospitalization. Again, may I just say this? Those are still huge numbers, and the 36,000 hospitalizations, no matter all the heroic efforts that are being put in to expand capacity, that is outside of any realistic ability of us to withstand that. So the social distancing must continue. We have no choice. One surgical mask per person per week. I've not heard that. Is that what type of workers we talking about?
It's a question from one of my colleagues sent me, so I'm not sure.
I'm not aware of that. Are you?
Yeah, I'm not aware of that either. We are looking at what hospitals are currently doing in New Jersey, because some hospitals are determining their own guidance, and we're looking at what's going on nationally, making sure that we have the appropriate masks for the clinical staff. We are looking at putting out guidance for masking after we finish finding out what the rest of the nation's doing.
I'm not sure who you may have in mind, Brett. I'm not running for anything right now, but my personal opinion is people should not be going door to door campaigning. Period. That's not what we need right now. Stay at home. Pick up the telephone. Send an email. Send a text. Unless I get any disagreement from the right. Police officers. Number of infected. Did you have? I'm sorry.
A number of police officers who have tested positive, and how many are quarantined.
I got that, Go.
Okay, Pat.
As of today, as of this morning, it was 562 statewide tested positive, and right now 2,941 are self-quarantining.
Thank you.
Pat, do you have any, I should know this, what's the denominator total law enforcement?
I think it's 36,000.
I was going to say 35, so
Yeah.
this seems to be a convenient number, by the way, 35, 36,000. Just looking at and I'm looking at, how many quarantine again, pardon me?
Almost 3,000.
Almost 3,000.
So we had, to give you an idea, within the next 48 hours, 111 will be back to work. So we're on a daily call with
Cycling through.
just always making sure that we're able to provide law enforcement.
This is another reason. I mean, we've talked about the heroic healthcare workers, the first responders who have to go in and enforce what we're talking about. They're putting themselves in harm's way, and they're doing this at less than capacity. Brett, your illegal immigrants question, you said we're top
it says,
five?
This is again from colleagues.
Yep.
I get like 30 colleagues send me questions a day.
No problem.
New Jersey has the 5th highest number of legal immigrants in healthcare who are not working in the healthcare industry because they hold degrees from foreign universities or do not speak English well. Are these among the people you are asking to volunteer to help cope with the coronavirus?
The answer is yes. We were pretty definitive about the fact. My friend Felix Roque in West New York was pounding away on this point for many days, and the answer is yes. But they've got to go through a process, right? So they've got to sign up in the regular way to sign up and volunteer. It's the volunteer page on the covid19.nj.gov. And then you were saying your last one was.
This is from Politico about the regional approach to restarting the economy. Will that rely on widespread testing in each state, and how long do you think it will take to scale up to that testing level?
I would say too early to tell, and perhaps other governors would have more color on that. But, I mean, the House is still on fire, and we're still fighting the fire, but we acknowledge, and that was the basis I was on last night with the Center for American Progress. I mentioned Andy Slavitt earlier. That was the basis of a lot of the part of my conversation with Governor Cuomo. It certainly, and Judy and Ed, tell me if you see this similarly, the notion of contact tracing is going to have to be a big part of making sure that the house doesn't catch on fire again. There's going to need to be infrastructure. You know, what's a restaurant look like? Do you have somebody with a temperature gun at the outside? And what are the protocols going to be for servers and capacity and distance? I think too early to tell, but we can't, I do know this, we can't wait X weeks or a couple of months to begin to be, we have to start that, which now, and we think that if we do it on a regional basis, just as we did when we closed the economy and we closed our states, we'll be a lot better off for that. Ed, anything you want to?
Yes. What the governor said, basically. You know, right now, when we're hopefully moving towards the top of the curve, when we have 44,000 cases and that sort of thing, contact tracing and all those people is just not possible. As we begin to slide down the curve, as our number of cases decrease, then yes, certainly beginning to go back to that basic epidemiological response where you try to find those people, you try to isolate them as soon as possible, it becomes extremely important.
Thank you for that. I think we're going to Dave next. Dave, good afternoon.
Hi. So, Governor, as you are, I'm sure, are aware, high school graduation is a big deal, not only for the kids, but their families, relatives, and so forth. And it seems extremely obvious at this point, even in the best case scenario, we're not going to have large gatherings for high school graduations at the end of May or June. Question for you and the Commissioner. If there has not been any specific plan made in terms of delaying those ceremonies, possibly, as the Commissioner had indicated to me before the press conference started, what would your advice be to families in terms of how to look at this issue? Would it be possible that we may have bigger kinds of celebrations later in the year that the individual schools might suggest? Is there going to be a virtual graduation when kids graduate at the end of the school year, which presumably is not going to start again, and so forth? Another question for the Commissioner. You had mentioned that 110,000 kids, I believe, in New Jersey did not have any access to the Internet. So that's like 10% of the state's children. How are they learning? What are they doing? In simple terms, are they getting any lessons? Or is there, what, if anything, is being done with regards to trying to help those kids at least have some kind of structure and assistance and learning and so forth? And the final question for the woman who needs no introduction. You had mentioned the plan by the state to try to help the long-term care facilities and separate those patients who may be asymptomatic or we don't believe are sick now. But as we know, this can be tricky because they may appear to be asymptomatic. Obviously, this is a plan in flux and you're just starting to put this together, but can you talk a little bit about how this is going to be handled? Would they, if they're moved, would they be in a quarantine situation? Is everybody going to have to wear masks? Where are they going to go? Is it going to be in the same region of the state, or et cetera, et cetera?
I'll start with the first one, Dave, on the graduations, and then maybe turn to Lamont for anything on that he wants to add, as well as how are the kids learning. We had talked earlier about pre-printing materials 1 month at a time. I'm sure that's part of it. And then, Judy, to you on the long-term care. I'm not trying to be flippant, but I wouldn't put any non-refundable checks down on your celebrations right now. It's hard to say otherwise. I hope I'm wrong, but I fear that I am not. Again, we're going to get through this. There's no question about it. And notwithstanding what Judy and I have said about the fatality, bless each of those souls, the numbers moving around, the testing numbers are beginning to look like there's a trend, and I hope I'm right about that. So, slowly but surely, assuming we keep our foot on the gas, we are going to get there. But I think you would be, you wouldn't be, in my shoes, you wouldn't be dealing with the facts if I were to say publicly right now that you should feel okay about a late May, early June graduation celebration. I just personally don't see it. I hope I'm wrong. Whether or not we can come back and figure out something creative, I hope we can. And my suspicion is that'll be up to the district or to the private school or the religious school to do something creative on their own, just like we're seeing, sadly, funerals and memorials, weddings, births, bar mitzvahs, confirmations in a very unique, creative way. My guess is you'll see something similar applied to graduations. Any thoughts on graduations and also importantly on remote learning?
Yeah, you're actually correct. The governor's correct. Yes, I am, sir. Graduation is a local decision, so whatever event and activity they plan, we just hope that they follow the health guidelines as far as social distancing and things of that nature. And we'll provide whatever support necessary for those districts that chose to go graduation. But when it comes to that time, and in regards to the tool online learning is just one tool. The goal for us, the objective was to provide continuous instruction, continuous instruction can look like many ways. In some districts, we have, as the governor said, pen and paper packets go home every month. Kids get them back. They have their books. They have book reports. So there's various tools that you can actually use. Online is just one tool, and it's popular right now because a lot of technology. However, there are districts that go back to just the pen and paper traditional route.
Could I just ask a follow-up, Commissioner? Are you getting reaction feedback from your different school districts? Is that working? Are kids doing what they're supposed to be doing? Are they getting encouragement? Is the learning taking place the way you envision that it would and should?
Okay. No, I'm very pleased with where we are. I mean, in 20 days, we asked them to go from a brick and mortar school to a virtual learning school. So you know there's going to be challenges. I talked about earlier about the digital divide. And you see right now we're addressing those issues. Districts are taking upon themselves to address those issues as well. So we're very pleased with that. Some of the challenge you're going to have is youngest of learners that I indicated earlier. How do you parents at home working with these younger students that normally have one-on-one or paraprofessionals. So we're seeing some of those challenges, but we're also looking some innovative approaches that our districts are doing, whether it's looking at YouTube, whether it's the partnership that the state has with the Department of Education, NJTV, and also NJA to provide educational programming. So it's an individual localized situation, but our job is to support them every which way we can, whether it's support for professional development, professional learning, which is one way, whether it's just providing guidance across the board. So right now we're in a position we're very pleased with where we're going right now.
I would just add a couple of quick things, and Judy, you should address the asymptomatic question as it relates to long-term care facilities. You can't bat 1,000, as we've never done this before. We've got per capita more school districts than any state in America. We've got more school districts than we have townships. So you've also got a question of execution at the local level with strong state leadership and state guidance. And then you've got the other realities, and Christine Norbert-Beyer referred to this when she was with us last week. We have to also remember that things like, we saw that very sobering chart of lesser child abuse reporting. I'd love to think it's because less of that's going on, and please God that is, but it's much more likely that there is less interaction with teachers, coaches, nurses who would otherwise have seen that. So that's another part I know of, not just Lamont's focus, but also of the other state agencies and departments. Judy.
Sure. The direction that I've given to the team is to look at a statewide plan, but with a regional approach. And there will be an algorithm where we'll identify patients, for example, asymptomatic, no exposure, asymptomatic exposure in an organization where either the employees or the other residents, that there's a significant cluster or outbreak, symptomatic but test negative, symptomatic, and test positive. And I'm sure there might be more iterations of that. And then we'll identify the most appropriate location for the resident to be in. And within the locations, there will be all infection control precautions taken, along with cohorting of the residents and also cohorting of the staff. We have found that staff going from facility to facility and then within facilities have lend itself to some of the problems that we're seeing. So the algorithm is going to be a little deep, but we think we can do it, and actually we must do it.
Thank you, Dave. Thank you, Judy. Do you have something, sir?
Governor, a couple questions for the reporters at NJTV News. So as long as we've been getting together like this, we've been talking about people who aren't listening or adhering to your social distancing guidelines. Is there a tipping point where you implement a full lockdown? Is that on the horizon? Bus riders on NJ Transit complain that there's not enough distance between because of service cuts. NJ Transit is saying it's only a few bus routes that are affected by this, and they don't have enough manpower to add more service. But riders that have no choice but to take the bus don't feel safe. Do you have a comment on that? And finally, in business, can you update us on how the process for collecting unemployment is going, since there's so many people who are trying to get unemployment and just can't seem to get through?
So I'll I think these are largely on me, but anyone would like to come in, please feel free to jump in. I think as you've seen today with state and county parks, which is a big step, the question of a full lockdown, there's not much left that we haven't bolted to the floor at this point. We are still looking at a few other, Judy's just been, in answer to Dave's question, long-term care facilities is an area where we know that we need to even drill down even further. We've talked about corrections. I think our commissioner is going to be with us at the end of the week. Homes for the developmentally disabled, psychiatric hospitals. There are certain pockets of our state, of communities of our state, where we know we need to be as sharp as we can be. But there are other steps that we're considering, but we've taken most of the big ones that we think we both need to take, and at the same time allow the state to reasonably and responsibly get on its feet in a reasonable time frame. On NJ Transit, and Dan Bryan is here, who spent a lot of time there. You've got to, we want to know if folks are having that experience, go on our website and let us know explicitly which route that was. NJ Transit's got the challenge right now, and I'm not absolving a bus that's overcrowded, but diminished service. Their ridership is down, I think, 93%. They've also got manpower challenges, which are real. And when we hear these stories, we want to make sure we run them down. And there's still a lot of particularly essential folks who are using buses in particular to get to healthcare worker, by example, get to a hospital. So I'm not going to say we're batting 1,000, but we do want to know those experiences. And I can't throw a rock at NJ Transit because I know that ridership is way down. Service has to somehow approximate that, and they've got real manpower issues. Business, unemployment, pardon me. I don't have an update for you today. I promise you Mahan or Dan will get you one in terms of what their numbers look like in terms of early week. Rob Acero Angelo talked about, I forget what day he was with us, but they had processed 33,000 claims. We'll come back to you and give you a sense of how many claims they're processing per day right now, and give a sense maybe what the backlog looks like. I don't have a specific answer. Thank you. But again, we're on it. And by the way, if you are having trouble getting through, again, there's a page on covid19.nj.gov. If you've lost your job and you want advice, you want to know where you need to go to get unemployment insurance, etc. Troy.
Yes, thank you, Governor. Just one question and maybe a follow-up today. It's for Dr. Repillette. It's about long-range facilities plans for districts. The New Brunswick Board of Education submitted an amendment to their long-range facilities plan that is controversial, to say the least. I, for one, have not been able to obtain the language of this amendment because the Board of Education has stopped responding to Open Public Records Act requests, and I know other community members are still waiting on records requests that would show the extent of contamination at sites where school construction is proposed. So in light of that, Mr. Commissioner, will you wait to make a final decision on this very significant proposal until the state of emergency is over and the public can obtain the information that they need to give your team intelligent and informed input and make their voices heard?
Do you have anything else, or is that it?
That's all, just maybe a follow-up depending on the answer.
Depending on what your answer is. Okay. Lamont?
Well, there's a process, but right now we're in the midst of ensuring we have continuous instruction. However, I have Colleen Schultz, our Deputy Assistant Commissioner, right there, get the information in regards to we can try to track down and find out exactly the long-range facility plan that you're actually talking about, because that sits in our Office of Finance, so we'll make sure we get back to you with that.
Okay, thank you. And just in case you do move forward with that process, how would you advise parents and taxpayers and other stakeholders to either protest the plan or provide comments or input? I'm sure they could have a gathering outside your office, but the governor and the state police probably wouldn't look too kindly upon that.
So I would say, back to what you asked me about protests the other day, don't protest as a group. We respect folks who want to protest, find some other way to do it, virtually, online, whatever it might be. And secondly, we're going to get back to you with a more specific answer on this in particular. That's okay. Thank you. Do you have a question, sir? No, you're good? Back here? Elise? How are you? Come on down. Matt?
I'm good. Thanks for asking.
So we'll make sure, can someone get back, make sure with Lamont's office we get back to Troy. Thank you.
What's the status of any ventilator ethics guidelines that the state was considering? Nursing home operator Care One reportedly had 5 coronavirus deaths at its New Milford location in Bergen County. Care One issued a statement saying it wasn't prudent for it to update the public daily on coronavirus in its nursing homes. What information exactly have you told nursing homes to make available, and to whom? What is the deadline? How much information does the state have from nursing homes on hand? Are there penalties for noncompliance? And has Care One responded to the state's request for information about New Milford and its other locations? And finally, a FEMA question. You've had a lot of praise for FEMA's work in New Jersey. Other states aren't so happy. Does New Jersey have a special relationship with FEMA because of Sandy? In other words, did that disaster help ease operations for this one? Also, some states and even a hospital system here in New Jersey have said that the federal government has seized some equipment shipments. Do you know whether any of that has been redistributed for use in New Jersey? That's it.
May I just, I think, Judy, you should hit the ventilator guidelines and nursing home questions, Care One, and more generally. I just want to repeat something Judy said earlier. We remain, I'll do the litany as I do every day, we remain way short of ventilators, personal protective equipment, beds, and healthcare workers. So we need help on all of those fronts. We're doing everything we can to stay out ahead of it. So with that health warning having been spoken, over to you, if I may.
I didn't catch all of the questions on Care One, but I can tell you that we're in actual regular daily communication with the principals from Care One because of their exposure in the state. What I mean by exposure is the number of facilities that they have. And we're working with them to determine whether their facilities can support the statewide plan, along with a number of other systems that have a number of facilities within the state. Specifically, Elise, I'm not sure what else you wanted about Care One. I just didn't hear it.
Well, I'm asking what you've requested from nursing homes throughout the state, what the deadline is, and to whom this information will be made available, and has Care One responded to the state's request for that information, and are there any penalties for noncompliance if a nursing home operator chooses not to disclose coronavirus information?
Well, the first thing is we put out a guidance yesterday to all the long-term care facilities that they must report through the portal that the New Jersey Hospital Association has set up. I have to tell you, I think that they're all reporting. I don't get any indication that they are not reporting, particularly their COVID-19 individuals, residents. I just don't have indication that they're not reporting. And by the number of reports that we have, which are over 1,000 at this point, I believe they're reporting.
I think the penalty would have been we named and shamed, right?
Yeah, and we still may have to publish along with the statewide plan what this looks like. I just don't want to put out information and say there it is. Right. We have to put out information and say here's the plan.
But are individuals who have family members, will they be privy to the information that's being put out? In other words, what is the purpose of collecting this information? Is it solely for the state's benefit, or will this information be disclosed publicly, and when?
We've asked every long-term care facility to advise, according to their statutory obligation, to advise the residents, the employees, and all of the relatives of the residents of any outbreak, of any type of infection. That's been on the books for a while. We reminded them of their responsibilities, and as I shared today, we're calling every single one of them and asking to show evidence of documentation that they have either sent a letter, an email, or made a phone call to the individuals noted in the statute. It is important for individuals to know what's going on in these residences, and we feel strongly that the obligation rests with the owners. However, we do believe at the Department of Health we have an obligation to protect all of the residents of New Jersey, including the most vulnerable, which are in the nursing homes, and that's why we are moving to a statewide plan.
Again, the onus is, and we're going to go to the FEMA questions because we got to keep rolling here, but the onus, if it's your loved one who's in nursing home X, it's nursing home X's responsibility to communicate with you and next of kin. It's less, I would think, less valuable to hear about aggregate data or data that relates to some other loved one's nursing home. FEMA. I think there are several elements to this, but I want, when I give you a quick answer, I'd like Colonel Callahan to come in behind me on this. I think the elements that I would suggest are common ground that any state, and our state, for obvious reasons in particular, has been able to find with the administration and the federal government as a general matter. I think it also depends on the relationship you have with the particular FEMA region. In our case, Region 2. And Tom Von Essen is the guy who runs it. Number 3, as Pat Callahan may have mentioned, I think he did, the Army Corps matters here, and the relationship with FEMA does matter. And Sandy experience actually is relevant at many levels, including some of the specific players who are still on the scene, who are now working with us. So I think it takes, and I hear this all the time. I have nothing to do with this because it's Pat and Judy and their teams. I heard this from the general who's up from Georgia this morning. He said, you all have a really, the Rock is a unique asset. You've got really good people. You've got a war room mentality. Keeping the barriers low between parts of government is a huge part of the mantra that we've tried to execute on from day one in peacetime as well as in a challenge like this. So the fluidity of the relationship between Judy and her team, just to pick, and Pat and his team, or when Lamont's making a decision about shutting schools, the fact of the matter is people get around one table. That all matters, I think, in our ingredients into having a good relationship. Pat?
I would agree, Governor. I think across all the pillars of emergency management, we are shoulder to shoulder with FEMA, from preparedness, response, recovery, mitigation. It is a daily relationship, and certainly Sandy assisted in that, but we probably had, if I'm not mistaken, more than a dozen since Sandy. Well, it was El Derecho, straight line winds, flooding, Irene, snowstorms. All of those come with it the responsibility of doing preliminary damage assessments and then working through that public assistance and mitigation process to recover all of those federal dollars. And again, whether it's Tom Von Essen, Pete Gaynor himself, and on this particular disaster, the federal coordinating officer, who's FEMA's leading rep embedded at the Rock, is the retired major of emergency management from the state police. So you just couldn't ask for a better combination to all strive to get to that, that goal of guiding us all through this crisis. So it's a special team to be a part of, Elise. I
forgot, Elisa, my answer. That it's nice to have a guy who was a major in the New Jersey State Police on the other team. And Jared Maples has lived this. Dan Kelly in my office. These folks are known to each other, and that helps.
Yeah.
One more time.
The ventilator ethics guidelines.
Oh, sorry.
What is the status of that?
I missed that. Ventilator ethics guidelines status.
We have a professional advisory committee that's looking at not just ventilators, but in a crisis mode, all of the types of decisions you make, admission, discharge criteria to a field hospital, those types of medications that we need to have on hand to advise our team to make sure we have what we need. And ventilator allocation and all medical treatment allocations are being discussed. So we will be coming out with some guidance for the individual hospitals. We do know at this point that mostly every hospital has their own guidance, what we call a value-based or ethical decision-making process, and we will be putting guidance on top of that to make sure that as a state we are considering all of the special populations that we have and the types of decisions that have to be made.
Sorry about that. I forgot that question. But secondly, just as a general matter, when folks hear these questions and then they hear our answers, the point is not to shock people or make them feel uncomfortable. It is to give folks the confidence that while we are hoping for the best, we're considering all alternatives, all paths, all considerations. We have to. We would be abrogating our responsibility if we did otherwise. As again, this is a war with two fronts. One front continues to be all 9 million of us pounding the heck out of that curve, staying at home, keeping away from each other, and lessening the burden. The other front is making all the decisions, capacity and otherwise, over here in the healthcare system. Please God, the 9 million of us, the so many, do the work over here so that the so few over here don't have to deal with these eventualities. And we have the capacity that we need to be able to digest this crisis. So thank you. Again, sorry I missed it. Nikita.
So I have a few for you today. I'm wondering, have you spoken with either Bernie Sanders or Joe Biden about the issues that New Jersey faces as a result of this crisis? Have you gone to any of your predecessors in the governor's office for advice on how to handle the same? And on compliance for either you or Colonel Callahan, have there been any issues of election-related noncompliance incidents, whether it be political events or canvassing or anything of the like? And then lastly, have there been any changes, or are there any changes under consideration for safe haven laws in the state?
For what, sorry?
For safe haven laws.
Okay. I have not spoken with either Joe Biden or Bernie Sanders. Nothing personal, by the way. I just haven't spoken with them. Want to make sure this isn't one of them calling me right now. Predecessors, I'm sure I have. I'll have to come back to that. I'm just. I know I've gotten inputs from a lot of folks. I get that constantly. I'm sure that was one of them. I mostly have looked, frankly, at models of what's worked and what's not worked in other challenging times in the past. So, Pat, are you aware of any election-related noncompliance?
I think I would be, and I've not heard of any.
Nor am I. I'm not at all. And safe haven laws, Paramount, anything you want to add to that?
No, I don't think we've had any discussions on that.
I don't think we've had any not that I've been a part of, and I assume we didn't know. Thank you. John.
To quickly follow up on some of the things that Lisa was asking about nursing homes, is there a deadline for the nursing homes to disclose this information to you, and if there's any penalties to be assessed on that? And then I have questions regarding the decisions, Governor, you were talking to other governors about reopening things. What specific benchmarks are you looking at to make the decision about reopening things? And the way things were shut down in New Jersey, it was a rolling into the full lockdown. Do you envision, or have you discussed whether restrictions will be lifted all at once or eased into? And again, have you, in making these decisions and talking about them, have you thought about how you're going to do this again if needed, if there's a bounce back in the virus? And again, following up on the New Jersey transit questions, is there any consideration at all to halting New Jersey transit services if, especially in the crowded bus lines, that social distancing can't be maintained? And given the staffing shortages, there's almost, I think, 800 or so employees on quarantine and several ill. And again, on the developmental disability in the psychiatric hospitals, is there widespread testing of employees right now, or just symptomatic employees? And can you give any specifics about the Hatteras Printing Company, how that donation came to be, who did it? And a while back, you signed an executive order about providing hospitals required.
John, you're starting to sound a lot like Brent.
There's a lot of questions.
Yeah.
You signed an executive order for this hospital to provide information to you guys, and you said that would at some point be made public. Can you provide the daily updates in terms of hospitalization, ICUs, all of that in the charts that you present at the beginning? Because people are really wondering how many people are sick, are they getting better, what's it looking like? And that's one of the biggest questions we're getting for that kind of information.
Let me hit a couple, and then Judy. I almost don't even like talking about lifting restrictions because we're not even close. So let me just say that as everybody watching, stay at home until further notice. We're not close to changing things. I hate to break people's bubbles, but we're just not close. And we've got that curve has got to come down, even with the heroic efforts by all of you out there. Almost all 9 million of us. We've brought the numbers way down, but they're still way above any capacity we have, realistic capacity we have in our healthcare system. And I don't begrudge your asking the questions, but just to say that again, very limited right now. I just don't have any good specific because it's just too early to tell. I think and I want to go back to. I want Ed to answer the question of what he would look for as an epidemiological matter, and that's the most important part of this. But in terms of specifics, very, very limited, but I do know a couple of things. We're going to need, really good data. We're going to need some amount of infrastructure. The more regional we can be, the better. And I would say in terms of the lessons learned, John, from the bringing us down, do those lessons apply symmetrically in reopening? Not necessarily, because, and I'll give you a good example today are state and county parks. I don't think we thought 2 weeks ago that was a step that we necessarily had to take. And it was raised to us. First of all, the anecdotal evidence was challenging, Pat. I think it's fair to say this was not somebody throwing a Pink Floyd party on their front lawn, but it was too many people gathering in too close a proximity. You've got a hip bone connected to the thigh bone. If a local municipality closes its park or County X closes their parks, which they have a right to do on their own before today, in now case, as of today, they're all closed, then you put undue pressure on the state park that was nearby that was left open. That's one example. I don't know that how we got to the closing down piece, and we're still considering other steps, necessarily informs what the opening up reality will look like as well. Ed, as an epidemiological matter, what would you want to see before you said it's safe to put your toe back in the water?
There's no single perfect measure that we can look at. I mean, we've talked many times about the question about testing, and in an ideal world, what you know from testing. So what we look at is a combination of a whole bunch of different things, most of which are really backward-looking. I mean, we put a lot of emphasis on things such as deaths. We know that somebody who died now was probably infected 2 to 3 weeks ago, so that's very far backward-looking. We've talked about the number of new cases, and we look at that as well, but that's really looking back probably about 10 days or so from the time they got infected till they got tested and so forth. We do look at the number of patients in the hospitals, but again, that's backward-looking. It tells us what the capacity is as far as hospitals goes. It doesn't tell us how many new people are going to be coming into that picture and going to need care. We look at things like utilization in emergency departments, essentially how often are people going to emergency departments for symptoms that are suggestive of COVID. That gets us closer to when they were likely infected, but that's still also backward-looking because it takes an average of about 5 days for people to develop symptoms, another 3 to 4 days after that before they would typically show up in an emergency department. So to kind of answer the question, we are looking at all these, and we're looking at the positivity numbers that we've talked about many times. We'd like to see the percent of positives go down because that would again suggest with the same amount of testing that this was less common in the population. So we're looking at all these different things, and we'd like to be able to say, hey, there's one number. When this number gets below 12 or whatever, that's going to be when we'd recommend opening things back up. We can't quite say that because it's a much more complicated picture.
Let me ask Judy and Ed a question relatedly. The positivity percent is going up at a very slow rate at the Is that also a curve that folks should know that we look at as well?
And Ed, you can correct me, it's not only the positivity percent, what we look at are the number of people in the hospital as a percent of the people testing positive. We know nationally 80 to 85% of individuals have mild, that are COVID positive, have mild or moderate symptoms. We know that 15 to 20% may need hospitalization. And then again, 3 to 5% may need intensive care. So if we look right now at the percent of hospitalizations as a percent of those that are positive, we're about, I think, 17.5 or 18%, which kind of tracks what we would expect to see, 20% coming into the hospital.
Recognizing that the denominator is, of course, highly...
It's the information we have, but it just kind of track what the rest of the nation and other countries have seen.
Let's quickly answer a couple of these. NJ Transit bringing to a halt, the answer is no, just because we've got too many essential workers. We need to get them to where they got to get to. I think, again, I'll harken back to Dan in the back. We want to hear to the earlier question, however, where there's a persistent challenge in terms of overcrowding on a particular line. That we do take seriously, and we can't let that go without addressing it. Judy, real quick, and also I think you asked at the end about hospital data. I mean, would we consider putting what we have in our charts to put up in lights?
Yeah.
I assume the answer is yes. Assuming if it's data that we get every day, Mahan, make sure it's not an eye chart, that you can actually read it. I'm certainly, the more information we can give to folks, the better informed they're going to be, and that helps all of us. Judy, real quick, deadline on nursing homes, penalties, anything on developmental disability testing, and was it Harris Printing?
Hatteras, the one to which you gave a shout out earlier.
Oh, Hatteras, yeah. What was that about?
Any details about how they came to you? Who was it? That kind of stuff.
Yeah, I don't have the detail on how it came to me. I apologize. I didn't understand the question. But we can come back to you on that. This is Hatteras Printing, which, by the way, is a great success story, and hats off to them again. We'll come back to you in terms of how they got to us.
Sure. We're testing symptomatic individuals and then doing within the facilities contact tracing and quarantining those that have been within 6 feet of the individual that has tested positive. So quarantining, isolation, all of the epidemiological and infection control precautions. But it starts with symptomatic individuals first.
How about deadlines and or penalties on nursing homes?
Well, we've suspended our regular inspections. Our survey teams right now, to a person, are on nursing homes. They're, along with the infection control team from CDS, they're visiting nursing homes, they're training, educating, trying to see face-to-face what's going on. We have not considered levying penalties during this time. Our work is to try to improve the situation and make the right decisions for the residents.
Thank you. So I want to thank Judy, to you and Ed and your teams who are doing extraordinary work. Thank you, and keep up the great work. Lamont, to you and your team members, both here and back at this point probably in their homes. Pat, to you and colleagues. Jared, likewise. Paramel, thank you. Again, we will be in Edison at about 10:15 in the morning, surveying the field medical station. And then we'll be back here, unless you hear otherwise, at 1 p.m. tomorrow. Thursday's a little bit to be determined because of the White House VTC. And Friday morning, assuming, Judy, we get the data, we're going to try to be here early to let folks be out before noon to observe Good Friday. Thank you all.
us about equipment and their needs is very important. All of their supplies, hospital occupancy is critical. A lot of the occupancy is really getting a little bit lower than anticipated, and that's good. We sort of thought that was going to happen. And we're getting along very well with the governors. This whole situation with respect to talking to us about equipment and equipment needs, giving us a little bit of lead time, so important. All the supplies, we're getting it to everybody like they never thought possible, but we'll ensure that we can rapidly deploy federal assets where and when they're needed, especially on ventilators. We're actually getting some ventilators back. As you know, the state of California was great. They sent some back, which they won't need, to the four leading, I call them the genius companies. They're doing incredibly well with respect to cures and also with respect to a vaccine that's going to protect us, totally protect us. And they have some great potential. It's going to take a little while yet, but they have some great potential, some great early results. And the governor's been working hard, and we are working hard with the governors. There's been great coordination, especially over the last little while. We're giving them a lot of equipment, ventilators, but a lot of equipment of all types. And I will protect you if your governor fails. If you have a governor that's failing, we're going to protect you. But the governors are working well with us over the last period of time. Today, in our stockpile of ventilators, and again, we need the stockpile so we can immediately move them from place to place wherever the monster hits. It's a monster. We have 8,675 ventilators right now in stock, ready to move. And we have all sorts of incredible soldiers. Our military is going to move them should they be needed. In, as an example, if we need additional in New York or the New York City area, you have state, you have city, and spoke to Mayor de Blasio, and we really have a great, well-coordinated campaign with Mayor de Blasio. It's been really good. Spoke to Governor Cuomo. There's been great coordination. So if they need something, we have it. If Louisiana needs something, we have it. Same thing with Michigan. Same thing with Illinois. There are certain spots that are very hot. And we'll see what happens. But we'll know pretty much we'll have time, and we'll be able to move it. In addition to the 8,675 ventilators, we have 2,200 arriving on April 13th. We have 5,500 arriving on May 4th. These are ones that we're building for the most part. And we have, as you know, great companies building them. Ford, General Motors, GE. We have really some great companies that are doing it. On May 18th, we have 12,000. On June 1st, we have 20,000. On June 29th, we have 60,000 ventilators coming, 60. So we have a total of 110,000 ventilators coming over a short period of time. I don't think we'll need them. Hopefully we won't need them. I don't think we'll need anywhere near them. But we'll have them for the future, and we'll also be able to help other countries who are desperate for ventilators. The UK called today, and they wanted to know would it be possible to get 200, and we're going to work it out. We got to work it out. They've been great partners, United Kingdom, and we're going to work it out for them. So they wanted 200. They needed them desperately. We now have 10 drugs in active trials, with 15 more soon to follow, as well as 2 vaccine candidates in active clinical trials. We'll do whatever it takes to secure needed medical supplies and bring more production of essential medicines back to our shores. We're doing that. We're bringing them back to our shores. A lot of these companies, they went a little bit haywire They went away from this great country and they had them produced elsewhere. So we're going to start bringing them back. I've been talking about that for a long time, not only with medical, but lots of other things. America continues to perform more tests than any other nation in the world, and I think that's probably why we have more cases. Because when you look at some of these very large countries, I know for a fact that they have far more cases than we do, but they don't report them. We've performed 1.87 million tests to date, so that's 1,870,000 million tests. Think of that, 1,870,000 tests to date. And now we're performing them at a level that nobody's ever seen before. As we announced yesterday, CVS testing sites in Georgia and Rhode Island will be using Abbott Labs' rapid 5-minute tests. We're down to now 5 minutes. It's a 5-minute test so that people can get their results back very quickly. To address this challenge, it's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot, but it's been disproportional. They're getting hit very, very hard. In fact, while we have Tony here, I'd like to maybe have you come up and address that one, and then I'll continue. But if you could address that, it would be great, Tony, please.
Yeah, thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications. Thank you, Mr. President.
Thank you very much. And Tony, I think you're going to have some pretty accurate numbers over the next few days, right? But they are they're very nasty numbers, terrible numbers. In total, 1,200 Abbott machines, Abbott laboratories have been fantastic, have been shipped now nationwide. Up to 500 more are being produced every week, and 50,000 testing cartridges are being manufactured per day. That means a lot of very fast tests. No nation in the world has developed a more diverse and robust testing capacity than the United States. We're dealing with other nations, helping them out because the testing is very tough for them, and our tests are very accurate. A lot of tests are out there and they're not accurate at all. In fact, some of the tests, you don't have a clue what's going on. So we're working with other nations trying to get them help also. At a time when many Americans are experiencing increased stress, anxiety, and personal loss, we must also ensure that our country can meet the mental health needs of those struggling in this crisis. There are people struggling. They're struggling. And some people are getting to know each other, frankly. Some families are getting to know each other on a positive note, but there are a lot of people struggling. On Thursday, I'll be speaking to leaders and advocates from the mental health organizations all across our country. And we are going to be talking about resources and tools that we'll make available to them. They need help. And it's a big problem. When you take something where it was the most successful country in the world, still is, the whole world is shut down. Think of it, we're down to numbers that are incredible. As I said yesterday, I think it's 182 countries right now. 182 countries are under attack by the scourge, by this virus. But as we wage medical war on the virus, we're also speeding economic relief to our people. It's incredible. We just had a meeting that was absolutely incredible with the banks. I spoke with leaders in the banking and finance industry about our efforts to help American workers and employers. As of today, small business has processed more than $70 billion in guaranteed loans and will provide much-needed relief for nearly 250,000 businesses already. So we are going to be providing tremendous amounts of money to the small businesses of our country who have been absolutely clobbered. And they'll be keeping open, and they'll be paying their employees, and they'll be all set to go. We're going to have a rocket upward. I want to thank David Solomon, CEO of Goldman Sachs, Brian Moynihan, CEO of Bank of America, Gordon Smith, co-president, COO of J.P. Morgan Chase, Charles Scharf, CEO of Wells Fargo, Michael Corbett, CEO of Citigroup, Al Kelly, CEO of Visa, Michael Miebach, CEO of MasterCard, Noah Wilcox, CEO, Chairman of Grand Rapids State Bank, and we had numerous others also on the call, and I just appreciate them. We're way ahead of schedule, by the way. We're way ahead of schedule. The Paycheck Protection Program has been incredible. So based on the incredible success of the program, I'm announcing that I'll be asking Congress to provide an additional $250 billion for the Paycheck Protection, which will help keep Americans employed to facilitate a quick and full recovery. We're doing very well. We're looking very bipartisan. A lot of people want to do it, and the plan is amazing. You know, they're processing hundreds of thousands of loans, and this is the big banks that are doing it, the community banks. But the biggest banks right now in our country are doing it, and they're doing it for a lot of reasons. One of them is they want to help people. The WHO, that's the World Health Organization, receives vast amounts of money from the United States, and we pay for a majority, a biggest portion of their money. And they actually criticized and disagreed with my travel ban at the time I did it, and they were wrong. They've been wrong about a lot of things, and they had a lot of information early, and they didn't want to. They seem to be very China-centric. And we have to look into that. So we're going to look into it. We give a majority of the money that they get. And it's much more than the $58 million is a small portion of what they've gotten over the years. Sometimes they get much more than that. Sometimes it's for programs that they're doing, and it's much bigger numbers. And if the programs are good, that's great as far as we're concerned. But we want to look into it. World Health Organization, because they really are, they called it wrong. They called it wrong. They missed the call. They could have called it months earlier. They would have known. And they should have known. And they probably did know. So we'll be looking into that very carefully. And we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it. And we're going to see. It's a great thing if it works. But when they call every shot wrong, that's no good. We're in the midst of a great national struggle, one that requires the shared sacrifice of all Americans. In recent weeks, it's been remarkable to see so many companies and organizations and individuals, like the banks that I just told you about, biggest banks in the world. They stepped up to help small business. They're big business, small business. The small business will someday be the big business. But the small business is 50% of our economic strength. People don't realize when you add them up, but they just rose to the occasion. Everybody's rising to the occasion. It's been incredible to watch. To honor and celebrate the extraordinary examples of patriotism and citizenship, I'm asking Americans to use the hashtag America Works Together when sharing stories of how we're all working together, getting through this ordeal in a fashion that nobody would have ever thought possible. It's been incredible, and that's why the numbers are so far much better. We want to keep it that way. If you look at the original projections, if we did nothing, it would be disastrous. If we decided to do something, we closed it down, had no choice. It was a good move. That was a good move. The early China move was a good move. The early Europe move was a good move. We had a lot of good moves, but closing it down was a big statement. It was a big important thing, but we're looking to have far fewer deaths than originally thought, and I think we're heading in that direction, but it's too early to talk about it. I don't even want to talk about it now because we just want to work, and I think that people are doing an incredible job. The doctors, the nurses, the firefighters, the police, all medical people, what they're doing, the bravery that they're displaying is just incredible. Every citizen should take immense pride in the selflessness and all of the courage and compassion of our people, the workers, the people that are working, and construction workers going into hospitals, knowing nothing about this problem other than it's dangerous, and they go in there to rebuild sections of hospitals, and you have people in really big trouble right next door. They know nothing about it. All they know is they're going to get it done. They're going to fix that wing so they can have more people in there. It's incredible. But this is a national spirit that won our independence and settled the frontier and explored the horizons of space, and that's what we're doing. I mean, this is all new territory. It unlocked the miracles of science, and we're doing that. I wish you could have heard the calls I had yesterday with these great companies that come up with cures to diseases, and the success they've had over the last 15 years is really amazing. So I just want to thank all of them. They're working very hard. They're working with UK right now, and the UK doctors hopefully helping with their great Prime Minister. But these people are really tremendous signs of success are staring us right in the face. I think we're going to have something that's going to be great in terms of vaccines and in terms of everything else that they're doing. Just really helping us, helping the people of our country, and helping ultimately the people of the world. So I want to thank you all for being here. I will take some questions, and then I'm going to give it over to the Vice President, and they're going to go into great detail onto what we're doing and all of the successful supplies and medical equipment that we're getting. All of the ventilators, I've said it, but you can go over it in more detail if you'd like, but we're taking in and building thousands and thousands of ventilators, and they're very high quality. I said, you got to go for the quality, and these are quality companies doing it. So, because there is a big difference between a good ventilator and a not so good ventilator, Tony, right? We've seen that. And big difference. So we're going top of the line. Steve, please.
The acting Navy Secretary submitted his resignation today, Motley. Why did that become necessary, and what role did you have in this, sir?
Well, I had no role in it. I've heard, I don't know him, but I've heard he was a very good man. And the whole thing was a very unfortunate. The captain should not have written a letter. He didn't have to be Ernest Hemingway. He made a mistake, but he had a bad day. And I hate seeing bad things happen. Man made a mistake. But, you shouldn't be writing letters, and you're in the military. You're the captain of a great ship, and you shouldn't be writing letters and sending them to many people. And then it gets out to the media. And, the question is, how did it get out to the media? So there's a lot of bad things happened there. And I had heard he did because he didn't want to cause any disturbance for our country. So that was because he wouldn't have had to resign. I would not have asked him. I don't know him. I didn't speak to him. But he did that, I think, just to end that problem. And I think in really many ways that was a very unselfish thing for him to do.
What should happen now to Commander Crozier, who left?
Well, they're going to look at that. I think the Secretary of Defense, as you know, is Mark Esper, and he's very capable. And I think he's looking at that right now. They're going to just take it under regular Navy channels to see what they want to do. But he made a mistake, but he shouldn't have done that. And your secretary probably shouldn't have said quite what he said. He didn't have to resign, but he felt it would be better for the country. So I think it will end it quickly. Yeah,
Mr. President, a couple on the economic front. The $250 billion that was added today, or will be added for the small business loan program, brings it to $600 billion in total. Do you think that figure is enough? Might there need to be more down the line?
When you see hundreds of thousands of applications, don't forget they're for $3,000, for $7,000. some for a couple of million. I guess one of the banks said a couple of million. So they're for different, very varying amounts of money. And there's a limit on the top, and then there's really no limit on the bottom as to what it might be. But it's really popular. It's hundreds of thousands of applications. They really like it. What I like is it keeps these companies together, these little companies. Just like we're going to help the airlines and the big companies, we're going to help the little companies. And the banks are running. Nobody's equipped to do a thing like that, but the banks are equipped. So the banks are doing it, big banks, small banks. We have many banks, community banks, and they're processing the loans, and they'll be able to watch it and make sure it's done properly.
Talk today, sir, as well about potentially reopening the economy in the upcoming weeks. You mentioned the other day about a potential economic task force. Can you give us some sort of update as to where
we're
that
thinking about that, but we want to open up, and we want to get it open soon. That's why I think maybe we're getting to the very top of the curve. I spoke with Governor Cuomo, and he seems to think that he's getting close, and I think a lot of people think that a lot of places are getting close. We want to start hitting the downside, and I think we're going to be doing. This is going to be a very difficult week, however. This week will be a very difficult week because that's the most difficult week when you're at that top position, and we'll see what happens. We'll see what happens.
It does open up. What can the federal government do?
Well, the federal government has done a lot, and it's going to do a lot. We want to. I really think that with the stimulus, we can be maybe even beyond. We're going to do perhaps infrastructure, which you wouldn't have gotten approved before, and now people are looking to do it. And the beauty is we're paying zero interest, or very close to zero interest. In some cases, we're paying actually zero, have no interest charge. And the dollar is very strong, and people are investing in the dollar. They want, the fact that we have the strong currency. We have our currency is everything. And other companies, other countries want to be in our currency. So we're getting all of investment wanting to come into the dollar. The dollar is the strength. The dollar is the whole ballgame. We have a strong dollar. Other currencies are going down, way, way down in some cases. You look at other countries, I won't mention them, but other countries are going down 22%, 25%, 28%, and it's very hard for them. That makes it much more difficult. With us, our currency is relatively now stronger than it ever was, or it was over the last few years relative to other countries. It's always relative to other countries, but our currency is very strong. So therefore, people want to invest. If we do a bond issue to do infrastructure, everybody wants a piece of that issue, even at zero interest. Yeah, please.
Did you see these memos that reportedly Peter Navarro wrote back in January? When did you see them, and how does these memos sort of square with what you've often said that nobody could have predicted this? It sounds like he was predicting it.
I didn't see him, but I heard he wrote some memos talking about pandemic. I didn't see him. I didn't look for him either. But that was about the same time as I felt that we should do it. That was about the same time that I closed it down. I asked him about it just a little while ago because I read something about a memo. I said, "Did you do a memo?" I didn't see it. I didn't ask him to show it to me. He said, "Yes, I talked about the possibility of a pandemic." Nobody said it's going to happen, but there is a possibility. There always has been a possibility, but people wouldn't talk about it. But it was right about the time that I closed it down. And interestingly, the World Health Organization was not in favor of us closing it down. And if we didn't close it down, we would have lost hundreds of thousands more lives. So he did a good thing. Yeah.
So at the time, though, when Peter Navarro did circulate those memos, you were still downplaying the threat of coronavirus in the U.S. You were saying things like, "I think it's a problem that's going to go away within a couple of days."
It will go away.
You said within a couple of days the cases will be down to zero.
Well, the cases really didn't build up for a while, but you have to understand, I'm a cheerleader for this country. I don't want to create havoc and shock and everything else, but ultimately when I was saying that, I'm also closing it down. I obviously was concerned about it because I closed down our country to China, which was heavily infected. I then closed it down to Europe. That's a big move, closing it down from China and then closing it down from Europe and then ultimately closing it down to the UK. So, and it was right about that time. But I'm not going to go out and start screaming, this could happen, this could happen. So, again, as president, I think a president has to be a cheerleader for their country. But at the same time I'm cheerleading, I'm also closing down a very highly infected place, specifically the location, as you know, in China that had the problems. And we're closing it down, but we close it down to all of China, then we close it down to all of Europe. Those were big moves, and it was right about that time.
Sir, just a quick follow-up, Mr. President.
Did you just
Mr.
learn
President?
about this today?
Say it?
You learned about the memo today?
I read about it maybe a day ago, 2 days ago.
Do you feel like someone among your staff or Peter Navarro himself should have told you about the memo earlier?
No, it was a recommendation. It was a feeling that he had. I think he told certain people in the staff, but it didn't matter. I didn't see it, but I did. I closed it down. I don't remember it even being discussed. We had a meeting where there were a lot of people. Most people felt they should not close it down, that we shouldn't close down to China, but I felt we had to do it. And that was at almost the exact same time as the memo.
If you had read the memo at the time, how would that have changed the steps you took or the
I
statements
don't think it
that
would
you
have
made?
changed because I did. I basically did what the memo said, and the memo was, the memo was pretty good memo from the standpoint that he took, I guess. I didn't see it yet.
He was saying that the U.S. would lose, warning that the U.S. could lose trillions of dollars and millions of lives.
Well, you're not going to lose millions of lives, but you'll lose plenty of money. But I couldn't have done it any better because it was about the same time, and I closed it down to China.
And just lastly, so you maintain confidence in him, in Peter Navarro?
Of course I maintain confidence. He wrote a memo, and he was right. And I haven't seen the memo. I'll see it later on after this. But it didn't matter whether I saw it or not because I acted on my own. I guess I had the same instincts as Peter. Peter's a smart guy, and he's a good guy, and he's done a wonderful job. But he wrote a memo, and I guess he talked to various people about it. But ultimately, I did what the memo, more or less what the memo said just about the time the memo came out. I closed it down. I took a lot of heat. The World Health Organization was very much against. They didn't like it. They actually put out statements about it. In all fairness to Joe Biden, he called me xenophobic. Like, I don't like China. I like China. I like the Chinese people are phenomenal people. So I was called xenophobic. I was called racist. How could I do a thing like this? Now, since then, Joe said that he was wrong, and he said that I was right. But I closed it down, and I was called names by some of the morning show hosts who don't have a clue what they're talking about. They're not smart people. And I was called all sorts of names when I closed it down to China. Now they try and hide that, the tape of them saying terrible things. But that was a great decision. If I didn't do it, if I didn't do that, we would have had hundreds of thousands more people dying. Yeah, please.
You talked a lot about the WHO, and I was wondering, Dr. Fauci had discussed them earlier, so if I could ask you a question about...
Well, he respects the WHO, and I think that's good, and he's worked with them for a long time. But they did give us some pretty bad play calling.
They've also, I think, given lots of countries in the world accurate coronavirus testing that's been central to your guys' data modeling. And so
that I don't know. I can only say that with regard to us, they're taking a lot of heat because they didn't want the borders closed. They called it wrong. They really called, I would say, every aspect of it wrong.
So until the funding freeze.
I'm not happy about it. Look, we fund it. Take a look. I mean, go through step by step. They said there's no big deal, there's no big problem, there's no nothing. And then ultimately, when I closed it down, they actually said that I made a mistake in closing it down, and it turned out to be right. But at the time, they did that. So we're just going to take a look at it. We fund it, and they seem to be, I said recently in social media, I said they seem to be very China-centric. That's a nice way of saying it, but they seem to be very China-centric. And they seem to err always on the side of China. And we fund it. so I want to look into it. Yes, please.
Thanks. A quick follow-up on that. So is it time to freeze funding to the WHO during a pandemic?
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
You did say that.
We give a tremendous, no, I didn't. I said we're going to look at it. We're going to investigate it. We're going to look at it. But we will look at ending funding. Yeah. Because you know what? They called it wrong. And if you look back over the years even, they're very much... everything seems to be very biased toward China. That's not right.
I wanted to follow up. You talked about African Americans and how they've been disproportionately affected by the coronavirus.
Seems to be, unfortunately.
Do you plan on requiring the CDC, any federal agencies or state agents, public places doing tests, and private companies doing tests to collect that data on the race of the people being tested and the race of the people being treated and the outcome?
Well, we're just seeing tremendous evidence that African Americans are affected at a far greater percentage number than other citizens of our country, because we're dealing with our country. Now we're looking at it from a worldwide standpoint. Tony Fauci is looking at it very strongly, but these numbers have started to come out, and they're very strong, and they're pretty obvious. I mean, you're talking about...
You will release that publicly?
Would you like to talk about that for a second, please?
I think one of the things that we're going to be doing with our Medicare data is to do that analysis. We're going to look back at the last month or so and look at, related type illnesses going forward. We now have a code for coronavirus, so we can actually stratify by demographic information, so we can look at race as a factor. We can also look at what the underlying health issues are as well. So we'll be providing that data very shortly. But we will be doing that analysis.
We're working on that very hard. This is something that's come up over the last... I hadn't heard this, and then over the last few days, this has come up more and more. And I don't mean by a little bit. I mean many times. It's a real thing. Now, we want to find cures. We want to find therapeutics. We want to find vaccines, because that will solve everybody's problem. But why is it that the African American community is so much, numerous times more than everybody else? And we want to find the reason to it. And Dr. Fauci, Seema, both of them, and others are working on this. And they're going to have very good, I would say over the next, in less than a week, I think you're going to have very good statistics. Couple of days.
Something specifically aimed at those communities that are being hard hit, those black communities.
Well, we're helping them a lot. But what's happening is we're trying to find out why is it that it's 3 and 4 times. Now, maybe that's not going to be the final number, but why is it 3 or 4 times more so for the black community as opposed to other people? It doesn't make sense, and I don't like it. And we're going to have statistics over the next probably 2 to 3 days, okay?
Mr. President.
Thank you. I'd like to ask a question on behalf of myself and a colleague who couldn't be here due to social distancing. Sure. Thank you.
Who are you with? Who?
With Hearst Newspapers. I'm the print cooler today. Thank you. Some banks are only providing Paycheck Protection Program loans to clients with whom they have existing banking relationships. And you spoke to banking CEOs today. I wonder if you'll ask them, these lenders, to accept applications from all small businesses, sure, not just the businesses with whom they have existing
relationships. They'll be doing that. But we're also working with small community banks, so they will be doing that. It's a question I've already spoken about. I mean, in many cases, they have long-term relationships with thousands of companies. I was amazed to see how many, you saw the number of applications. It's hundreds of thousands. It's a lot of work. But I did ask that question, and they are working on that. Yeah.
Thank you. And my second question from a colleague is Congressman Jerry Connolly, a Democrat from Northern Virginia, told the local DC CBS station that you personally requested the CARES Act stimulus bill be stripped of $25 billion for the Postal Service. Connolly claims that unless the USPS gets that $25 billion, the agency will be run out of money by June. He accuses you of hastening the demise of the Postal Service. Could you respond to that, please?
I'm the reason the Postal Service has lost billions of dollars every year for many, many years. I'm the demise. This is the new one. I'm now the demise of the Postal Service. I'll tell you who's the demise of the Postal Service. Are these internet companies that give their stuff as packages. And I don't know why they're not, I don't run the Postal Service. You have a group of people, so-called independent people, and they run it. But these packages are They lose money every time they deliver a package for Amazon or these other internet companies, these other companies that deliver. They drop everything in the post office. They say, you deliver it. And if they'd raise the prices by actually a lot, then you'd find out that the post office could make money or break even. But they don't do that, and I'm trying to figure out why. These are independent boards. They were appointed by other administrations. They're sort of long-term. They're there for a long time. And I've been talking to them also. You can look it up. Take a look. They have to raise the prices to these companies that walk in and drop thousands of packages on the floor of the post office and say deliver, and they make money, but the post office gets killed. Okay, so they ought to do that, and we're looking into it, and we've been pushing them now for over a year, and you know that because you've seen the stories. I'm pushing them. It's not fair for them to these great, wonderful modern companies. They walk into our old post office with all these routes that could never be built. You could never build them. They go into areas that you could never do, and they say, here, deliver this. And they lose a lot of money per package, and they have to raise their prices, but this Postal Commission doesn't do it. Now, we just got a chance to appoint a couple of people onto the commission, as I understand it, and that's good. But they have to raise their prices, otherwise they're just going to lose a lot of money. And tell your Democrat friend that he ought to focus on that, because if he focused on that, he could truly save the post office. Post office has been losing billions of dollars a year for many, many years. And have him take a look at that, because that's the way to solve the problem.
Thank you so much, Mr. President. Thank you so much. Mr. President, you say this week will be very painful, very difficult, but a few weeks ago you say this was just like a flu. What have you learned?
I didn't say 2 weeks ago it was a flu.
The question is, Mr. President, what have you learned that you could offer as an advice to foreign leaders who still are skeptical about this pandemic and who are against social distancing? What is your advice? What have you learned?
I said it was just like a flu. So the worst pandemic we ever had in this world was a flu, and it was called, you know that, it was in 1917, 1918. And anywhere from 50 to 100 million people died. That was a flu, okay? So you could say that I said it was a flu, or you could say the flu is nothing to sneeze at.
Then what can you offer as an advice to foreign leaders who are skeptical about this pandemic and who are against social distancing?
Well, I think there aren't too many of them. If you look throughout the world, and everyone, just about everyone that has practiced that is now closing up. Well, the UK was an example. Now, they talk about Sweden, but Sweden is suffering very gravely. You know that, right? Sweden did that. The herd, they call it the herd. Sweden's suffering very, very badly. It's a way of doing it, but everybody has been watching everybody else. And so far, almost every country has done it the way we've done it. We've chosen to do it. If we didn't do it that way, we would have lost hundreds of thousands of more people. Okay.
Mr. President, there's voting going on today in Wisconsin. There are reports of thousands of people waiting in hours-long lines as they've had to weigh their own personal health and their civic responsibility. Do you think that the Supreme Court was right in its decision that voting should go forward and the absentee extension should not take place?
Yeah. Look, the Supreme Court, of course they were right, because what the Democrats wanted, and you know what this happened, I supported a man named Justice Kelly, who's Daniel Kelly, highly respected justice. And I supported him just the other day, social media. I know of him. He's just a fantastic justice, and I endorsed him. And as soon as I endorsed him, they wanted to move the election. They didn't want to move the election. As soon as I endorsed him, the Wisconsin Democrats say, "Oh, let's move the election to 2 months." Might having the election until I endorsed him, which is very interesting. And now they talk about safety. Well, it was 15 minutes after I put out an endorsement that they said we have to move the election. They didn't want to move the election before that. The other thing they wanted to do, which is crazy, at the end of the election, they wanted to have 1 week for proxies to come in or mail ballots. Now, mail ballots, they cheat, okay? People cheat. Mail ballots are a very dangerous thing for this country because they're cheaters. They go and collect them. They're fraudulent in many cases. you got to vote. And they should have voter ID, by the way. You want to really do it right, you have voter ID. But the Democrats, and this was turned over in the Supreme Court yesterday, I give great credit to the court, they actually didn't want to have an election day. They wanted to have election day, and then a week after election day, you choose your, all these ballots come in, these mailed ballots come in. Ballots are corrupt, in my opinion, and they collect them, and they get people to go in and sign them, and then they're forgeries in many cases. It's a horrible thing. And so what happened is the Democrats in Wisconsin, they had no problem with the election being today until I endorsed the Republican candidate, Justice Kelly, Daniel Kelly. And as soon as I endorsed him, they went crazy. They went crazy. And you know that's true. And now all of a sudden, because go back 2 weeks, go back 2 days, they didn't want to move the election. They were having the election. They were fine because they thought they were going to win the election. Then I endorsed them, and all of a sudden they think they're not. Now I understand there are lines that go back a long way. I hope they're going to vote for Justice Kelly. Okay.
Mr. President, do you think that Americans got to choose? With millions of pills of hydroxychloroquine donated, is there a plan or system in place to track the potential side effects?
Well, you saw the representative.
Serious harm. So, is there a plan to track the side effects?
The side effects are the least of it. You have people dying all over the place, and generally the side effects are really with the Z-Pack, having to do with the heart. The Z-Pack, that's the antibiotic, not with the hydroxychloroquine. So, a woman last night, I watched her on one of the shows, good show, Laura, and she was. She thought she was dead. She was a representative from Michigan. She was just in horrible shape for 12 days, 14 days. She thought she was dead. I think she said that her doctor said she's, it's going to be very tough. She saw me talking about this, and she asked her husband to go to the drugstore. Now, this is a Democrat representative, a person that, perhaps wouldn't be voting for me. I think she'll be voting for me now, even if she's a Democrat, even if she's a Democrat representative. And they went to the store, which I made available because we have millions of doses. We have, I think, 29 million doses of this drug. And she asked her husband, she said, please go out. I'm not going to make it. Please, you have to hear her story. Please go out, get it. He went at 10 o'clock in the evening to the drugstore. He got it. He gave it to her. Now, it's I don't say it works like this at all. 4 hours later, she awoke, and she said, I feel better. And then shortly thereafter, she felt great. This is a woman that thought she was going to die. She's a Democrat representative, highly respected woman. African-American woman. I don't know if you saw it. As you asked a question about African-American, she was an African-American woman, a great woman. Her manner of speaking, the was beautiful. I asked my husband to go and get it. He got it. She is now okay. She was interviewed last night on television, and she thanked me. She thanked me even in a tweet. She said, I want to thank President Trump. He saved my life. Look, I don't say that happens with everybody, but that's a beautiful story. There are many of those stories. And I say, try it. Okay, please. If you're in trouble, if you're going to die, and you're going to die, you're not going to die from this pill. Now, there could be some side effects, but the side effects is really more so from the Z-Pack.
Those side effects?
No. Doctors have to recommend it. I want doctors. I'm not a doctor. I'm just saying we hear great results. And some people say, let's go to a laboratory, let's test it for a couple of years. And we got people dying in this country and all over the world right now, not in a couple of years. They're dying. As we speak, there are people dying. And I really think it's a great thing to try, just based on what I know. Again, I'm not a doctor. And I say, get a physician's approval. And they have physicians in these hospitals, great physicians, brave physicians. They also say it's good for the hospital workers to take them, that it's keeps it away, keeps it out of your system. I don't know. But there's a lot of good examples. And, we have a 100 case study going in New York, and it's almost complete. So it'll be very interesting to see what happens. Go ahead.
Thank you, sir.
But I appreciate that woman. She was great. You have to leave it. The way she spoke, it was like a miracle. And this was not a fan of mine. But she's a fan of mine now, and I'm very honored by it. Go ahead.
Thank you, sir. Can you talk about your decision to remove Glenn Fine from the Pandemic Response Accountability Committee? And does that move and some of the criticism you've leveled at IGs, how does the American public have confidence that there'll be oversight?
Well, we have a lot of IGs in from the Obama era. And as you know, it's a presidential decision. And I left them largely. I mean, changed some, but I left them. But when we have reports of bias, and when we have different things coming in. I don't know Fine. I don't think I ever met Fine. I heard the name.
Wasn't it about?
I heard the name. I don't know where he is. Maybe he was from Clinton. Okay, you check that out. Okay, but we did change him. But we changed a number. We have about 7 nominations in, I believe. We put 7 very, very highly qualified people for the IG position. And, that's a decision that I could have made 3 years ago, and I could have made 2 years ago. And but we're putting in, not so much for him, we're putting in 7 names. I think it was 7, and they're going in now. Yeah.
Mr. President, when you talk about the WHO being China-centric, what exactly are you talking about? Is it because China's underplayed how many victims?
I don't know. They seem to come down on the side of China. Don't close your borders to China. Don't do this. They don't report what's really going on. They didn't see it. And yet they were there. They didn't. They didn't see it. They didn't report it. If they did see it, they must have seen it, but they didn't report it. Please, go ahead.
Mr. President, just turning back to the voting in Wisconsin and those long lines, who should be held responsible if people get sick after they voted?
Look, all I did was endorse a candidate. I don't know anything about their lines. I don't know anything about their voting. I love the state.
But you also encourage people to get out and vote today as well. Will you take some of the responsibility of some of those people
I won the
get
state,
sick?
which is rare for a Republican to do, but I won the state of Wisconsin. I'm going to win it again because we've been, as you know, with our policies, and they like me and I like them. But all I did was endorse a candidate that's highly qualified, very respected person, and all hell broke loose as soon as I did that. And then all of a sudden they want to change. Before I endorsed them, they didn't want to change this voting area. There was no problem with the Democrats voting until I endorsed the candidate. Then they said, let's move it 2 months. Let's move it 3 months later. Safety, 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 right? All of a sudden they went, well, before I did the endorsement, they didn't talk about safety. It was fine for months. For months, it was fine to be. And now I endorse, and they want safety. So, that sounds...
Thank you. Just to follow up on that, how does the election, them holding this election in Wisconsin line up with the social distancing recommendations that have come from your
administration?
There
you have to ask the people that you have a Democrat in Wisconsin as governor. Ask him. That's his problem. Okay, he should be doing it. Again, some governors fail, and I won't let them fail because when they fail, I'll help. But that's run by Democrats right now. Okay? It's run by Democrats. You had a great Republican.
Is it possible to socially distance when you're voting? You're going to have crowds.
You have to speak to the governor. What you should do is call the governor of Wisconsin and ask him that question. But also ask him, how come it was okay to do this until I endorsed the candidate? And as soon as I endorsed him, these lines are formed, and I hear, Mike, the lines are through the roof. So, hopefully they're going to vote for the right candidate. Yeah, please.
President, can I just check in on oil again today? I was wondering if...
Oil?
Yeah.
Where is it today?
Well, I was wondering if you...
No, where's the price? Give me the price.
I'm not sure, to be honest.
How can you ask a question when you don't know the price?
I'll look it up for you.
Okay, let me do somebody else then. Go ahead.
So you were highly critical of mail-in voting, mail-in ballots for voting.
I think mail-in voting is
but
horrible.
you voted by
It's
mail
corrupt.
in Florida's election last month, didn't you?
Sure, I could vote by mail for that.
How do you reconcile
Because I'm
that?
allowed to. Well, that's called out of state. You know why I voted? Because I happen to be in the White House and I won't be able to go to Florida to vote.
What's the difference between mailing within
well, there's a
state or
big
mailing
difference
outside
between
state?
somebody that's out of state and does a ballot and everything sealed, certified, and everything else. You see what you have to do with the certifications. And you get thousands and thousands of people sitting in somebody's living room signing ballots all over the place. No, I think that mail-in voting is a terrible thing. I think if you vote, you should go. And even the concept of early voting is not the greatest because a lot of things happen. But it's okay. But you should go and you should vote. I think you should go and you should vote. You look at what they do, where they grab thousands of mail-in ballots and they dump it. I'll tell you what, and so thank you all very much. Thank you.
Thank you all. A few updates, and then I'll introduce Dr. Deborah Birx to talk about what we're seeing around the country, what the data is telling us. But suffice it to say, as the President said several times, this is a very tough week in America. And our hearts go out to all of the families that have lost loved ones to the coronavirus. But I know I speak for the entire White House coronavirus task force when I say our hearts are with the people of the greater New York City area today. As we stand here today, in the midst of heartbreaking numbers of losses in New York City, I also want to assure the American people that there's reason for hope. As Dr. Birx will enumerate in just a few moments, despite the increase in losses, as Governor Cuomo articulated today, hospital admissions continue to decline. And in our report early this morning from Dr. Birx, we continue to see evidence of stabilization in some of the areas around the country of the most significant outbreak, the New York metro area, including New Jersey, Long Island, and Connecticut, New Orleans metro area, Detroit, Boston, Chicago, and Denver, as Dr. Birx will explain, continue to give evidence of stabilization, which in a very real sense is evidence that the American people are putting into practice the social distancing, the president's guidelines for our nation. And for that, as the president said earlier today, we thank the American people. Even in the midst of hardship and loss at a time when we've seen more than 385,000 Americans test positive for the coronavirus and more than 12,000 succumb to this illness. The evidence that Dr. Birx will describe to you will show that the American people know our future is in our hands. And so as I begin, allow me just simply to continue to urge every American to put into practice the guidance you're receiving from your state and local authorities. Take it to heart, take it seriously, share it with your family and your friends, and know that you're making a difference, America, because you truly are. Today, for my part, I spoke to over 500 small business owners in a conference call, and there I heard about their enthusiasm for the Paycheck Protection Program. And that call took place before the President had the Secretary of Treasury indicate our interest in acquiring another $250 billion for that program. As of this morning, more than $60 billion in forgivable loans that would cover 2 months of paychecks at small businesses had already been distributed, and the number is going to grow literally by the day. We also had a very productive call today with some other American heroes. You know, we all have in our hearts and in our minds our healthcare workers, and I'll speak for a moment about the supplies and resources that we're working to provide for all of them. But right below our healthcare workers are all the people that are working in critical infrastructure around the country, and some of the most important people are working in food supply. I mean, from the farmers and the ranchers to our processors, to our distributors, to our truckers, to our grocers. Americans are keeping food on the table for our fellow Americans. And let me begin by just saying what I said to some of the most prominent CEOs of meat and grain industry companies in the country, companies like Tyson Foods and Hormel today. Not just these companies, but to all the hard-working people working in food supply today, thank you. Thank you for what you're doing to keep those grocery store shelves stocked. Thank you for showing up for work every day and working food supply rolling in America. You know, it was more than 5 weeks ago that the president brought in all the grocery store leaders in the country, and there he received a commitment that no grocery store in America would close, and they haven't. But it's been these heroic Americans, from the farm to the fork, that have made it possible for Americans to have one less worry, and they are truly inspiring heroes. Now, that being said, I did hear from the industry today that there have been reports of some plants having reduced capacity because of people having concerns about exposure to the coronavirus. In fact, over the last several days, there's been some incidents of worker absenteeism, and some plants have actually been forced to close temporarily. And so on behalf of the President, on behalf of our entire team, and on behalf of a grateful nation, let me just say to all of you that are working in the food industry at every level across the country, just understand that you are vital. You are giving a great service to the people of the United States of America. And we need you to continue as a part of what we call our critical infrastructure to show up and do your job, and know that we're going to continue to work tirelessly in working with all of your companies to make sure that that workplace is safe. With that being said, let me talk about the other heroes that we always mention at this podium today, that Dr. Birx and Dr. Fauci invariably mention, and that's our healthcare workers. At the President's direction, we've been working tirelessly, literally around the clock, to identify resources around the country and around the world to make sure our healthcare workers have the support that they need. With some 51 major disaster declarations, most recently Minnesota being approved, states have stood up 27,000 National Guard. But personnel-wise, before the end of business today, there will be more than 3,000 Department of Defense and Health and Human Service medical personnel on the ground in the greater New York City area. And those people will be redeployed. The coronavirus epidemic in that area, and we salute those extraordinary patriotic Americans for stepping forward to bring real relief to our healthcare workers. With regard to equipment, Admiral Polovchek reported to the task force throughout the course today that we have continued to distribute ventilators across the country. We're sending additional ventilators from the strategic pile. Maryland will receive 50 ventilators. Delaware will receive 50 ventilators, and that will leave more than 8,400 ventilators still in the national stockpile. One correction from yesterday. After our press briefing yesterday, FEMA made a different decision with regard to what the state of California generously made available. Most in need. I asked them to break out a few details about resources that just in the last 5 days have been distributed, and I hope it's an encouragement to healthcare workers all across these regions and around the country about the effort that are being made to make sure they have what they need. You can see the New York metro area, including New Jersey, just in the last 5 days, more than 6 million N95 masks, more than 6 million surgical masks. When Governor Cuomo and I last spoke, he told me there was a real challenge for medical gowns in the New York City area and in New Jersey as well, and 2.8 million gowns were distributed to that region as well. Going next to New Orleans, where again, while we see some encouragement, challenges remain in that community. Some 837,000 N95 masks for healthcare workers, 165 surgical masks, other items including almost 6 million gloves have been distributed. Detroit continues to be a real focal point. We're working closely with Governor Gretchen Whitmer, as well as Mayor Mike Duggan, to meet the needs of healthcare workers in Detroit. Just in the last 5 days, 1.6 million N95 masks have been routed into the healthcare system in Detroit, nearly 700,000 surgical masks, and 24 million gloves, just as a portion of what's displayed. And in the Chicago metro area, which we continue to focus on each and every day, more than 1.7 million N95 masks have been routed into their healthcare system, 900,000 surgical masks, 25 million gloves. I share these details in the hopes that healthcare workers looking on will be encouraged. At the President's direction, we are making every effort to make sure you have the resources you need to do your job, to do it safely, and to go home safe to your family, even while you provide that extraordinary and courageous care that our healthcare workers are providing literally around the clock in the midst of the coronavirus challenge. The last slide is just the cumulative numbers that we have distributed, and I'm happy in a few moments to answer any questions about that. Again, the system that we have in place is one that is essentially infusing our major distribution networks with millions of items, and then FEMA is directing on a day-by-day and oftentimes hour-by-hour basis where those resources are most needed. And we'll continue to do that as the coronavirus makes its way through these communities and through communities that are very much on our watch list today. Let me just lastly say that, again, I want to thank the American people for stepping up and doing your part. We continue to be overwhelmed with one story after another where people are doing social distancing, where people are looking after one another, where they're checking in with a phone call to an elderly friend, a family member, to make sure they're okay. I mean, we are on the front end of 30 days to slow the spread. And I will tell you, as a non-scientist up here, that I see glimmers of hope in the early numbers that we're seeing come out of the greater New York City area, New Jersey, even New Orleans and Detroit and Chicago. There does appear to be, as Dr. Birx will explain in more detail, there does appear to be evidence of leveling, evidence of progress. But this is exactly the time for all of us to redouble our efforts to do everything each and every one of us can, not just to protect our own health and that of our family and our loved ones, but to do our part to ensure that we lessen the impact of the coronavirus on America as a whole, but even more importantly, that we lessen the impact on lives by ensuring that we do our part to make sure that no one that is vulnerable is unnecessarily exposed to this virus. With that, let me yield to Dr. Birx and then Seema Verma and Dr. Fauci, and we'll take all your questions.
Thank you, Mr. Vice President. So hopefully you can see from those numbers that we've taken a data-detailed approach, really bringing the power of granular data to the supply chain and moving supplies based on really what you would call burden of disease and need. If I could just start out by not just going to the numbers at the beginning, but really talking to the community of health advocates, to the community that works on the social determinants of disease and the communities of the historic Black colleges and universities. We really need to improve messaging, and I'm asking them to help us increase the messaging around this. We don't want to give the impression that the African American community is more susceptible to the virus. We don't have any data that suggests that. What our data suggests is they're more susceptible to more difficult and severe disease and poorer outcomes. And we really need to make sure that every household is aware of what it's going to take to protect the individuals in that household that have pre-existing conditions. We could call on the indigenous nations, the real tribal leaders, to also be working very closely to protect the elders of their communities. We know this is more difficult in multi-generational households, and it's really going to call for really unbelievable attention to details of hand washing and protecting others from each other, particularly if you don't feel well. This is really a call to action to the communities to make sure that we get messages appropriately out there so that everyone understands what it's going to take for us all to protect one another. And we know it can be done because we can see these changes. I wanted to go through the numbers at a high level so you understand why particularly these supplies went to these areas to begin with. We talk about attack rates or the cases per population. So in the New York, as a state, they have 7 cases per 1,000. This is the highest in the country. In New York City itself, it's closer to almost twice that in New York City. New Jersey is 4 per 1,000, Louisiana 3 per 1,000, Massachusetts 2 per 1,000, Connecticut 2 per 1,000, Michigan 1.5 per 1,000. The District of Columbia and the Baltimore area now 1.5 per 1,000, and we're watching them very closely. Pennsylvania 1 per 1,000, but we're concerned about Philadelphia. What is allowing us to move supplies based on burden of disease and need is the extraordinary West Coast that has had very low numbers, from Washington that was less than 1 per 1,000, California that is less than 0.5 per 1,000, and Oregon that's even less than that. And it's those states where there's large populations, because of the enormous work that they're doing to prevent expansion and spread of the virus, it's allowing resources to go to these states and these communities and these counties that need more support. And so this kind of data analysis is allowing us to make very intelligent decisions about need, but also really understanding what's happening across the country in the development of the curves, as you have heard about. And so we do see, and I know you heard me caution that over the weekend, sometimes there is decreased case reporting, and so there were increases in a series of communities on Monday. We're seeing that stabilize again, and when you look over 3 days, you're starting to see that we may be actually in a series of communities outside of New York and New Jersey and Connecticut, creating a much flatter graph. A much flatter curve. So you saw New York and the increase, and then you saw, we're hoping, as Governor Cuomo and the mayor has described, that they're getting to a steady state where the next outcome is going down. But we see across the country, in Detroit, in Chicago, some real, not this extreme going to 7 cases per 1,000, but really staying in the more 2 cases per 1,000 and a different curve parameter then. And it really shows the amazing activity of every American in those cities to really ensure that there's social distancing, and really importantly, to ensure there's less socialization between households, and really ensuring that the household really remains independent and protected, and not really at this moment going out into the community or socializing anywhere but a virtual way on computers, by Zoom, by FaceTime. And I think we can really see that in the data, and it's really given us great heart. I want to finish by really talking to my laboratory directors, because you're extraordinary and you've done an amazing amount of testing. Those nearly 2 million tests that we're getting to, those were all done in the last 2 to 3 weeks. But we do have excess capacity. So if all the lab directors could look in their laboratories, if they have an Abbott M2000, if they could get that up and running, we could double the number of tests that we're doing per day. That is a high throughput. The machines are throughout the United States. There's hundreds of them. Right now, about 80% of them are idle. We're going to have a call with the laboratory directors of these laboratories to really ensure this is an automated, robotic situation that they can run. There's over 1 million tests sitting. Test kits sitting, ready to be run. We have 5 platforms of tests. This is one of our really high volume platforms, like Roche, and we're really calling on them to really increase that capacity so that we can do not only increased diagnostic testing, which I think we're doing quite well right now, but also increasing the ability to do more healthcare workers, first responders, community testing, and surveillance. And then finally, you will see, and you've heard about it happening in the UK and other places, There's a series of antibody tests out there that have not been validated. We're working right now very closely with a series of companies that know how to make these tests, that have made these tests for us for decades, for HIV, for a rapid test. They're working on that technology to bring that quality of test, which is in the 90+% sensitivity and specificity, to the American people for antibody tests. But until we get those, if you see them on the internet, do not buy them until we can give you a test that's reliable for all Americans. And we are working very hard to have that happen and bring that to the American public. Some of the tests that may be available on the internet may have very low sensitivity and specificity and give you a false reassurance that you either give you a false positive or a false negative, implying that you may be protected. So please wait until we have available and validated. People are working around the clock to make those available to the American people. We know how important that is, because you've heard us talk about asymptomatic cases, and we really want to know how broad that is and how common that is. And so in places like New York City, where I described that they had a 7 per 1,000, sometimes 2, 3, and 4 times any other place in the United States, being able to know what the number of people who never had symptoms but do have a positive test would be really critical at this point, particularly as we plan for any reoccurrence in the fall or in future seasons. Thank you.
Great. And we have Seema Verma, Center for Medicaid and Medicare Services, will discuss what we've done to support hospitals. As we support healthcare workers, we want to make sure the institutions that are providing the environment for care are well financed, and she's got a couple of funding streams, and help is on the way. Seema.
Thank you, Mr. Vice President. And let me just start with echoing the President and the Vice President's comments about our condolences to all the people out there that have lost somebody to the coronavirus, and also sincere appreciation and thanks to all our healthcare workers that are on the front lines. But we know that it's the impact on the healthcare system isn't just those frontline workers. Healthcare organizations across the nation are having increased expenses. They're having to spend more on supplies. You're seeing all of the supplies that are being sent to them, and that's having a direct impact on their bottom line. Many of them are also having increased expenses because they're taking advantage of some of the flexibilities that we've given. Without walls, they're putting, you may see tents out in their parking lots where they're doing testing or screening, so they have a lot of increased expenses as well. Other healthcare organizations are not performing essential surgeries or other services. A lot of them are moving to telehealth, and that represents lost revenue for these healthcare organizations across the country. And so the President has asked us to address this issue. About 10 days ago, we put out something called accelerated payments that we do in the Medicare program, and it allows us to advance payments to providers based on their historical Medicare revenues that they receive. So just in 10 days, we've been able to provide payments to providers. We had about 25,000 requests. We've processed about 70% of these. It's happened in about 5 days, and the total on that is about $34 billion that we've managed to put into the healthcare system. But those are essentially loans. The President has asked us to go further with this and to start the implementation of the CARES Act. That provides $100 billion to the healthcare system. You've heard Secretary Azar talk about the focus on some of those dollars going towards the uninsured, but the President wants us to accelerate getting those dollars out. And so this week we will be putting out another $30 billion, which are grants. This is going to be based on Medicare revenue. There are no strings attached. So the healthcare providers that are receiving these dollars can essentially spend that in any way that they see fit. Also, this is going to be done in a very easy, simplified way. For many of our healthcare providers, we actually do direct deposit with them, and so those dollars will just go right into their bank accounts. For other providers, all it's going to require is some very simple registration, and we'll be able to give them that money as well. So we're expecting that to happen this week. The other thing to note is that this is not a first-come, first-served basis. Because we are basing this on their Medicare revenue, they will get these dollars. So even if it takes a few days, there shouldn't be any panic in the system as well. The other thing to recognize here is that our priority was on getting these dollars out as quickly as possible. We heard that from the many healthcare providers across the country that weighed in on this. They said the most important thing was to get these dollars out as quickly as possible. But we recognize that in terms of getting these dollars out, because it's based on Medicare revenues, there are providers out there, pediatricians, children's hospitals, OBGYNs, even our nursing homes, that a lot of their revenue comes from other sources, Medicaid or others. And so those organizations will be addressed in the second tranche of funding, and we'll have a priority for these organizations and these types of healthcare providers. Also just want to say, so together between the loans that we've put out there with our accelerated payments and the $30 billion, that's about $64 billion for the healthcare system this week alone. And so I think, again, this is part of our effort to support the healthcare system, and also just want to, again, say thank you to all our healthcare providers out on the front lines. To all Americans, the best thing that we can do to support our healthcare providers is to adhere to those guidelines around 30 days to slow the spread. That is the best thing that we can do to support our healthcare workers. Thank you.
Dr. Fauci, please.
I just want to make a brief comment to get back to the discussion about the health disparities in the African American community, because it really is very important. And the reason I want to bring it up, because I couldn't help sitting there reflecting about sometimes when you're in the middle of a crisis like we are now with the coronavirus, it really does have ultimately shine a very bright light on some of the real weaknesses and foibles in our society. And as some of you know, the greater proportion of my professional career has been defined by HIV/AIDS. And if you go back then, during that period of time when there was extraordinary stigma, particularly against the gay community, and it was only when the world realized how the gay community responded to this outbreak with incredible courage and dignity and strength and activism, that I think that really changed some of the stigma against the gay community, very much so. I see a similarity here because health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately. As Dr. Berg said correctly, it's not that they're getting infected more often, is that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate. So when all this is over, and as we've said, it will end, we will get over coronavirus, but there will still be health disparities, which we really do need to address in the African American community. Thanks.
Well said. Questions for our panel, please.
Yeah, for Mr. Vice President, and then a question for Dr. Birx as well.
Sure.
On the ventilator issue, with 8,400 of them in the stockpile and tens of thousands more coming, why are states like California and Washington needing to send ventilators to other states, and is that smart if they might need them later on?
Well, I'm going to let Dr. Birx speak about what's happening in California and Washington, because it is a real credit to the people of both states and the leadership of both states to see the progress that we've made. We continue to witness that the numbers where the outbreak began, we all remember when this first emerged in the Seattle area, the numbers continue to be steady and low. And what we've seen the governor of California do, what we saw the governor of Washington State do, and the governor of Oregon, where the coronavirus arrived to a large extent in Oregon, I think is in keeping with the highest tradition of the American spirit. And they are understanding what I think Americans are understanding more and more, that while we tend to think of this as one large curve in our minds when it began in our country, and we long for the day that it will end, and we want to hasten that day by putting into practice all these mitigation efforts. The reality is, what these experts have explained to this layperson, is that What we're actually going to witness is a number of small curves that will cumulatively mean that curve. And for Oregon, for Washington State, for California to recognize where the need is, and then to partner with us and FEMA to make sure the resources are there at the time of the need, at the point of the need, I think is really inspiring. But Dr. Birx, do you want to speak to that?
Yeah, I want to be clear. No, we didn't ask for their ventilators. They looked at their epidemiologic curves. These states have amazing health commissioners, and I think when this is over, we'll really be. All of the models were based on something we have never attempted to do anywhere in the world. We have never attempted to do this kind of mitigation. It was always theoretic to many individuals, and now we see across the globe people mitigating against this virus, realizing that their own behaviors can change the course and future of this virus in their communities, which is really astounding, the power that gives us to actually understand that we can compete against this virus and do well. And so I think their governors and their health commissioners looked at their curves, looked at their hospitals, looked at their ICU, and looked at their needs, and then decided that they didn't need those at this time and wanted to make it available for other states that were in more of that 2 per 1,000, 3 per 1,000, 4 per 1,000, and 7 per 1,000. And I think we'll learn a lot from other states and other communities to really understand how to do this better next time. And I think this is what will teach us, because we've never attempted anything like this, at least in my lifetime, where we've had, these 30 days to stop the spread. I mean, we've not ever put out information like that. So I think you heard the CDC director talk earlier today about in the models how different individuals thought communities would mitigate and the rate at which they would mitigate. And I think you can see that across the world, we're learning that when you give communities the information that they need to understand what's going on, and you're transparent, that communities can be part of the solution in a transparent and amazing way. And I think this kind of education and dialogue is always critical when you want communities. I think when I first started here 5 weeks ago, I said that we will win based on what the communities are able to do as a community of Americans. And I think we're all really deeply impressed about what they were able to do. So it was the governors who decided.
The testing backlog, I just had a quick follow-up question on that. How close are we to getting into that 24-hour window you've talked about being very important? And then what is the status of the self-swab test?
So we're tracking all of that very closely. I use my time here to appeal to people specifically, the health educators, the health advocates, because I know the power with them. But to my lab directors, I really need the Abbott M2000 online, because that means we can do an extra 100,000 tests a day. And there's enormous power in that. The ability to self-test, last time I had my test here, I self-tested, so done. It's straightforward. It works very well with that rapid 5-minute test. But what we now have to create, and I know that's all called because everybody wants one of something, we now have to create a mosaic that brings together where we know every single machine is in the United States, where our gaps are, and then align resources with need and gaps in the testing and ensure that we have the right laboratory test for the right community. So you can see there would be communities, particularly the Indian Health Service or rural communities, where that Abbott ID Now kit could be incredibly helpful, because otherwise they're shipping it all the way to capital states away, and that's going to add 2 or 3 days wait time, which we're trying to get away from.
Right. The backlog, 2 or 3 days, or what would you?
It varies state by state, and we'll be talking with all of the states, changing how we do testing in the community to really ensure that we're testing optimally, because right now we have still focused very much on hospital diagnosis because we know it will make a difference in treatment. So these major laboratories are still putting drive-through tests at the back to all the hospital tests. And so that's where the backlog is in the drive-through tests. So I know if you're an outpatient, not an inpatient, but a patient, that is where the delays right now are. But it's state by state, and so states have 24-hour, 48 hours for both their outpatients and inpatients. Others have short for inpatient and longer in outpatient, and then we're file those two pieces.
Right. And the team is actually meeting tonight to review that. But one of the data points that we review is literally on a state-by-state basis what the turnaround time is for testing, and we continue to work that. And these Abbott laboratory devices there's 18,000 of them across the country. When you go to your doctor office and get a strep test, it's that device. All Abbott Laboratories has done with strong and swift efforts of the FDA is create a test to put in that for the coronavirus, and it's a 15-minute test. And so I want to renew our call to all the healthcare providers around the country is find your Abbott device, and we'll work our hearts out to get a test to you. How about in the back corner?
Mr. Vice President, one for either of the doctors, if you don't mind. For you, sir, back to this idea of reopening up the economy, since it's not like there's a switch that you can just turn it back on, how does the administration envision this happening? Is it guidance from the White House and you hope the governors follow it? Or are you going to put it in the governor's hands or the mayor's hands? How do you envision all of that working together?
Well, the one thing I can assure you is that the president's decision in that regard is going to be informed by what the data shows and about decisions about when we can responsibly reopen America and put America back to work. I can tell you the CDC will have new guidance tomorrow that the CDC will be publishing for people who were in proximity to an individual that tested positive for coronavirus but have no symptoms. And CDC will be publishing new guidance about how those individuals and the circumstances under which they might be able to return back to work using some facial protection and monitoring their temperature. But we'll detail that for you. But what we're going to be doing over the weeks ahead is while we focus every day at the point of the need, as the president said many times, our first mission is to save lives, and that means to slow the spread, to bend the curve, to continue to engage the American people, which they are admirably doing, to continue to put all the social distancing into practice. But there is a dual track that the president has already initiated. Some of the best minds here at the White House are beginning to think about what recommendations will look like that we give to businesses, that we give to states, but it'll all, I promise you, be informed on putting the health and well-being of the American people first. Dr. Birx?
Either for Dr. Birx or for Dr. Fauci. Or do either of you want to take that? Or?
Go ahead.
Secondly, as a lot of parents are sitting home with their kids for weeks now, and they're wondering, maybe resigned to the fact that maybe their kids aren't going back to school this year, but are looking ahead. What do you think summer camp holds, and what do you think the start of next school year holds? If you could look down the line, do you think those start on time? Do you think school next year starts on time?
Can I say a word on behalf of teachers since I'm married to one?
There you go.
My wife was all day yesterday at the elementary school she teaches at, loading up about 500 bins of art supplies for kids. And she's just one of millions of teachers across this country who find themselves having to distance teach kids. And but relatedly, I'm proud of every teacher in this country. Secretary of Education was here not long ago talking about our efforts to expand distance learning resources, even in K through 12. To all the teachers who are out there, we just want to say thank you. Thank you for what you're doing, for continuing learning, even in this challenging time. And to all of the kids, just because you're home doesn't mean you don't have to do your schoolwork. Keep it up.
Anticipate children being back in classes in August?
What I will tell you is I'll yield to the health experts, but it'll be part of what we're looking at in terms of guidance going forward, whether it be summer school or whether it be returning to school next fall. But the most important thing we can do is put this epidemic behind us as quickly as possible.
Dr. Fauci?
Well, my daughter is a school teacher, so she asked me the same question. It is unpredictable, but you can get a feel for if we start talking about the things where the curve goes down and we really have minimal, how we respond and a rebound we see or don't see, I think is going to have a lot of influence, probably more immediately on things like summer camps than it does in the fall. I fully expect, though I'm humble enough to know that I can't accurately predict, that by the time we get to the fall, that we will have this under enough that it certainly will not be the way it is now, where people are shutting schools. My optimistic side tells me that we'll be able to renew to a certain extent, but it's going to be different. Remember now, because this is not going to disappear. So we're going to have in place the capability of doing the things that we talk about all the time on this stage, to identify, to isolate, to contact trace, number one. Number two, by that time, we'll have a better feel with the antibody test about what the actual penetrance of this infection was in society. How many people have actually been infected? Who's protected? If you have antibody, it's very likely that you're protected. Who's vulnerable? Do you treat vulnerables different than you treat the people who are protected? All of these things are going to go into the decision of just how much back to the original way we'd like it to be in the fall. Bottom line is no absolute prediction, but I think we're going to be in good shape.
Dr. Fauci? One for Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? You hear from coroners that that's not necessarily the case. Are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.
How about one more? A question for Dr. Fauci on the virus hitting Black communities the hardest. These numbers are staggering. Louisiana and other states are reporting 40 to 70% of deaths are African Americans. Do you expect that pattern to continue nationwide? Some states have not even reported their data yet.
I can't be confident to predict patterns, but the underlying reason why that is happening doesn't change from state to state.
So you expect it to get worse?
No, I expect that when African Americans get infected, given the disproportionate disparity of the underlying conditions that lead to complications like the ones I mentioned, I expect that we will still see the pattern that when you look at the proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans. I do expect that.
And is the federal government now leading the charge in collecting this information from the states, and when will it be made public?
Yes, the answer is yes. It will be public as soon as you get enough data to be able to make a meaningful statement.
So can we expect this week or a couple?
The task force has assigned that to several members of the team. We're assembling that data now. It is a great concern for us, and but it's probably a good reminder that we have to be especially careful around people with serious underlying health conditions. As we've said it many times from this podium over many weeks, that the risk of serious illness from the coronavirus remains low for the average American. But for anyone from any community that has a serious underlying health condition, particularly senior citizens with serious underlying health conditions, the risk of tragedy is very real. And so we're going to be very diligent about studying this and providing information and guidance in accordance with our best scientists. But I do want to say to each and every American, the President's coronavirus guidelines for America about wash your hands. If you're sick, stay home. If you can work from home, if you're not in critical infrastructure like our incredible healthcare workers or all those heroic people working to keep food on the shelves at our grocery stores and keep medicine at the pharmacies, we ask you to work from home if you can. Avoid unnecessary travel. Avoid gatherings of more than 10 people. Use a drive-through at a restaurant. Don't go in the restaurant. Not just to protect your health, but to protect those of every community, of every background in this country who may have underlying conditions that make them susceptible to tragic outcomes. That's how we can all do our part to slow the spread and to protect our most vulnerable. And the American people are doing it. And as we continue to do that, we will hasten the day that we put the coronavirus in the past and we reopen America and put America back to work. Thank you all. We'll see you tomorrow.
Bye.